Good morning, everyone. Johanna, are you in the Zoom room?
I am, and Live Manager has been started.
Excellent. Thank you so much. And so I take it that you can hear us, Matthew and Jake?
Yes, we can hear you well, Sam. Thank you.
Excellent. Okay, so
Check, check.
Recording in progress.
Supervisor or Chair Sabatier, I think we are ready to start at 9 a.m. when you are.
All right, 8:58 at the moment. Thank you. How are you, Brock?
Great, how are you?
Thank you for coming and doing the video this morning.
Fine, thanks.
Just wanted to check in with Ms. Grant and CAO Hutchinson. At this moment in time, you're not in the Zoom room. Are you ready to keep moving forward, or do you want me to wait till you're logged in?
I'm landing in there right now.
Okay.
Thank you. I'm sorry for my delay.
No worries.
Yeah.
Luckily, we're not Houston.
Launching in multiple directions. How about that?
Okay, I think we're ready to go. All right, welcome to August 31st. This is a special meeting of the Lake County Board of Supervisors. We are going to open up our meeting with a moment of silence, which I believe Supervisor Crandall and Supervisor Scott have won. So, please.
I would like to dedicate this moment of silence to the 11 Marines, 1 sailor, and 1 soldier that we lost in Afghanistan this last week.
I would like to offer a moment of silence to the Williams family. They lost a newborn within a 30-day period, and we don't know why these things happen, but we'd like to send our love and our thoughts to the family, the Williams family.
Supervisor Pyska, would you please lead us in the Pledge of Allegiance?
I pledge allegiance to the
flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you very much for that. Checking in with all Board of Supervisors and staff, are there any extra items to be added to the agenda today? Hearing and seeing none, let's go ahead and move forward. We have some items on the consent agenda. Are there any items that anyone wishes to pull? And seeing none, let's go ahead and open it up for the public. Any items from the consent agenda that anyone wishes to pull? And let me open up my participant list on Zoom. Again, if you're on Zoom, please press the button at the bottom of your screen for raising your hand. If you're calling via telephone, dial *9. And again, if you wish to pull an item from the consent agenda, please go ahead and raise your hand. And seeing none, let's go ahead and bring it back to the board for action.
Mr. Chair, I move to approve consent agenda 5.1 through 5.7.
Second.
We have a motion from Supervisor Scott and a second from Supervisor Simon. Roll call, please. Johanna.
Okay, Supervisor Simon,
Yes.
Supervisor Crandall,
Yes.
Supervisor Scott,
Aye?
Supervisor Pyska,
Yes.
and Supervisor Sabatier.
Aye.
Thank you.
Thank you very much. We don't find ourselves in this position. We're ahead of time too often. Let's go ahead and start with supervisor calendars, and let's start with Supervisor Simon.
Thank you. Finishing up the board meeting today, I have on Thursday, I have on my calendar South Deal Committee meeting, Friday, the Drought EOC, obviously the holiday weekend this weekend. Next week, I have on Wednesday, the Lake Church LTA APC. I think there is a meeting this evening. I just saw an email or something. Brendan, we have a 5 p.m. meeting this evening. I saw something from Carol.
Yes, with Senator McGuire
Yes,
and the
Senator
rest of the
McGuire.
folks
Yeah,
for the fire.
Cash fire, yeah, so that just came up too, so. And then,
Should add that.
The supervisors, I assumed, I forwarded that to you, assuming you'd want to be present.
yeah,
as you were last
absolutely,
week.
thank you very
Okay.
much. That'll be coming up. And then, moving right into the next weekend, and meeting with Carol on the 13th, and the, obviously, Tuesday, 14th meeting.
Thank you very much. Supervisor Crandall?
The day you picked me, I'm not ready. Okay, so we got, tomorrow I have the TID Earth CSA2. Thursday, I have Solid Waste Task Force. That was, last week got moved to this week. Let's see, and then South Deal meeting, it looks like we have at, well, it looks like I have a conflicting, yeah, it's conflicting, so I'll have to figure that one out. South Deal and the Solid Waste Task Force, so we'll figure something out on that. And then Friday, I know I have, oh, no, I don't have anything Friday, it's open. And then, of course, the, let's see, we got Labor Day next week. And Clean Water Program Management Council meeting on Thursday the 9th, and then Monday 13th, Middle Creek Restoration, and then back here for a meeting with Carol and a meeting on the 14th.
All right, thank you very much. And Supervisor Scott?
Well, today, we're going to be getting our items to the fair, so make sure if you've entered items to the fair, you get them in today, baked goods and I believe produce from 2 to 7. And then tomorrow, I have a 9 o'clock systems cohort meeting at 9, and a 10 o'clock focus group aligning systems. On the 2nd, I have an ACT meeting looking at documents before we move forward with that at 11 o'clock. Continuum of care at 3 o'clock, that will be via Zoom on the 2nd. And then the fair opens that night. Then on the 8th, I have First Five, we're looking for our new executive director, so we'll be looking at our transition team at 8 o'clock in the morning that morning. At 9 o'clock, I have a mental health facility conversation via Zoom. And then at 1 o'clock, I have another ACT meeting. On the 9th at 9 o'clock, a Zoom maternal health meeting. Then SafeRx 10:30 on the 13th via Zoom, and then back here on the 14th.
Thank you very much. Supervisor Pyska?
Well, I have 2 things to report. South Lake Fire Protection District this weekend had a giveaway. It was called Operation Force Multiplier, and they gave away tools like McLeod's to stop fires and water fire extinguishers. They have a back order list because so many people were interested. This is funded through a lot of different grants. After the Fire, Rebuild North Bay was one of them. Just a whole slew of supporters for this program. But the most important thing that happened was somebody picked up their equipment, was trained how to use it, which is what part of the presentation on Saturday, was driving home, came across a vehicle fire, and put it out. Helped put it out. So already it's been a success. So the whole idea of this is to have these tools in the hands of all of our residents and law enforcement and first responders. So that's why it's called Operation Force Multiplier. So it's already been a success. So big thanks to Chief Wink for writing those grants and putting that program together. We also had a vaccination clinic at the Kelseyville Apartments on Thursday. We were there for 4 hours, and there was a resource fair with First Five and lots of our other support groups, and we were able to vaccinate 38 people that day. So it's really great. They're going to be set up again in a couple weeks to do the follow-up appointments. And that was through our partners with Sutter. And Dr. Pace was able to come that day, and it was just a really wonderful event. So we're working through that. We're army crawling, getting more and more people vaccinated, and this was a population that really needed some attention. And so I really want to thank everybody that came out and supported or put together that event to support that group. So today, after our board meeting, I'm also going to be dropping my items off at the fair. Tomorrow morning, TID, and there's the cobbler check-in in the evening. It's fire season, so everybody has to stay vigilant and practice. Thursday, I have some doctor's appointments. Friday.
I'll take care of yourself.
Thank you. Friday morning is our comprehensive drought planning meeting, and a meeting with Brian Fisher in the afternoon to talk about TID issues. Saturday, the fair auction, I will be there. It starts at noon. Sunday is the Fiddler's Jam. I hope everyone can go out and do that if they're not at the fair. Monday's Labor Day. I hope everybody gets a great break. Tuesday, I don't have anything scheduled yet. Medical advisory meeting is on Wednesday the 8th. Thursday, Fire Safe Council and the geothermal meeting are both at the same time, so we'll have to work that one out. Friday the 10th is open, and then coming back on the 13th to meet with Carol.
Thank you very much. Just from my past meetings that I had, did meet with Supervisor Paiska and the rest of staff that's on the team to meet with our investor contractors, investing the management of our investments, and very hopeful that we are aiming in the right direction where we're going to get some very positive outcomes. So looking forward to continuing those conversations, and it looks like that conversation will continue possibly on September 10th. Let's see, tomorrow, things are fairly light right now on my calendar when it's a split end of the month like this. So meeting with Senator McGuire about cash fire, still crossing my fingers, toes, and whatever else I can possibly cross that we can get on the state emergency and federal emergency list. I know that many of those conversations are occurring at the state level, and there's a lot of support throughout the community and surrounding agencies trying to make that happen. So very hopeful on that. On Thursday, I have a Csac board meeting, so that should take up the majority of my Monday and part of my afternoon. Have a Csac call later on, and then at 6 p.m. a Clear Lake City Council meeting. Friday's pretty much everything about the drought, starting off with the drought EOC, and then looking forward to that conversation about the comprehensive drought plan. We need to have something that we can pull out of the shelf that's all prepared, ready to go, so that when we do declare a drought emergency, there's ready to go actions. So looking forward to that type of conversation and what it is that we're going to be drafting and bringing back to the board. On Monday the 6th, I have a Middle Creek committee. Let's see. LTA APC the following Wednesday. And it looks like our clean water program got postponed. Meeting again with our investor group, and then PEG board on the following Monday. So far fairly light, but I'm sure things will fill in the next couple of weeks. So that's it for me and everybody else. So let's go ahead and continue with our 9:06 a.m. item. which is an update on COVID from our schools. So Lake County Schools COVID-19 update. I'm so sorry, I just skipped public input. 9:05 a.m. Public input. Is there any public input on anything that is not on our agenda today? And seeing no hands in Zoom and nobody here in the boardroom, let's go ahead and close public input and open up item 6.2, Lake County Schools COVID-19 update. And with us, we have Superintendent Brock Falkenberg. Thank you for being here today. Would you like to take a seat?
Sure.
In front? That way, if people have questions for you, you can remain.
Well, good morning, and thank you very much for your time and the opportunity to share today. I walked into this and I felt very comfortable, and then I kind of took a look at the agenda, and now I'm really nervous because you've already gotten through all of your untimed items, and I see I have roughly an hour to fill. So I hope I'm entertaining enough.
We have a long expectation.
So I'm just going to jump in if that's okay.
Please.
Since March 16th of 2020, the superintendents of Lake County 6 school districts and LCOE, as well as our leadership teams, have been meeting weekly to support each other through this COVID-19 pandemic. I should say at least weekly. Dr. Pace, Carolyn Holliday, and Denise Pomeroy have joined us for almost every one of those meetings. At least one of them have joined us for almost every one of those meetings. And I just want to make sure I recognize them and thank them for their leadership and their guidance as schools have navigated through this whole process. I also want to make sure I recognize Rob Young. Rob is the Lake County Office of Education Emergency Services Coordinator, amongst many other hats that he wears. And it is a position that I established 5 years ago, specifically to have someone that can focus on emergency crisis at those times when we need that focus, and we need that liaison between the schools and the operations center, and in this case, public health, so that we don't have all school districts and staff members reaching out directly to public health. We have a chain that they can work through the County Office of Education and try to alleviate some of the burden that comes with trying to serve 6 or 7 school districts in the county. 1 second, I'm sorry.
We're going to take a quick break, I guess.
We're there. All set? Okay.
Just a quick fix.
So we've now reached this point where we are shifting, and I'm going to go back to the 2021 school year real briefly. Upper Lake School District, Lucerne School District, and the Lake County Office of Education offered in-person instruction through the entirety of the last school year. So while the LCOE programs are relatively small, I'm smiling at you. While the LCOE programs are relatively small, the other 2 school districts were able to successfully navigate through COVID in the 2021 school year. All school districts, including those that were open, had distance learning opportunities for any student who could not or should not be in a face-to-face setting. Beginning in April of 2021, the other school districts that were not in that face-to-face setting began to open up to open their classrooms back up to students, and had AB days, or days when only half the students would come in. And again, half the students was half of the students that were ready to return, so those numbers ended up being relatively small in some of our school districts. Our school districts need to be commended for several items, and I probably am going to miss some, but one of those is the fact that from day one of this pandemic, they have been offering meals to all children in Lake County and continue to do so. Our maintenance teams have taken the time to go through and upgrade and revamp our HVAC systems while students were out of the classrooms. And of course, our teachers and administrators were able to implement distance learning. And my wife is a teacher. She teaches at Mountain Vista in Kelseyville. And while she chose to return to the classroom each day for her instructional period, the distance learning really kind of was a change in dynamic. It opened up our household to all of those kids in her class, as well as their households to her. So in a traditional classroom setting, for example, students need help. And in a traditional school day, we would raise our hands and student or the teacher could respond. Well, in a distance learning model, text became that way to raise your hand. So texting became open and available 24/7. Now she limited it. She said, I'm done at 9 o'clock at night. But she was able to support students from 8 a.m. till 9 p.m. every night and worked diligently in that process. And while I'm singling her out, our teachers all worked diligently to implement a new instructional model, and that is distance learning. And there are things that we need to keep from that and learn from that and continue into the future. Now we find ourselves rolling into the 21-22 school year. And our schools are required to be fully open again. So on August 11th, Lakeport Unified, Upper Lake Unified, and Lucerne Elementary School District celebrated their first day of school, their back-to-school day. On August 16th, Middletown Unified School District, Canocta Unified School District, and the Lake County Office of Education began our school year. And on September 7th, Kelseyville Unified School District will begin their school year. While all of our school districts will continue to require or continue to offer independent study model of instruction, meaning that students can remain home, they can remain in the safety of their home through this pandemic, what we are seeing is over 95% of students have chosen to return to classroom-based instructional settings. But again, I do want to re-emphasize that children who cannot or choose not to receive their instruction in a classroom-based setting have options. They just need to talk to their principal and get enrolled in an independent study program. Independent study is not like it used to be in the past. Elements of distance learning are now required. So there is daily synchronous instruction required within that independent study model, particularly for our younger grade levels, and that is reduced as students get older and it moves back toward that more of an independent study, self-paced, guided practice sort of curriculum. It has been a challenge to move to the point where we can safely and transparently and deliberately open our schools. And I do want to make sure I thank our teachers and our classified staff for all of the additional work that they have had to put in preparation for opening schools in a COVID-19 year. Some of the things that we have recommended that schools implement include regular and consistent, transparent communication with their community and their staff and their parents. We have recommended the inclusion of signage on all of our campuses and being prepared to modify that signage as the situation changes. So, for example, there is no longer a requirement on school campuses to maintain that 6 foot of social distancing. So while we are still trying to engage in spacing, that 6 foot requirement isn't there, and sometimes our signage may need to change appropriately. We are supporting hand washing not just like we traditionally have at the preschool level, where every student washes their hand before they start, as they come in each day, before they leave each day, and before each meal or snack each day, and we sing a hand washing song. We are now implementing that in the grade school level, and then we are encouraging our middle school and high school students to regularly engage in hand washing. We're reducing crowd size, so eliminating rallies and eliminating school-wide assemblies. And we are requiring staff and students who feel any illness to stay home. You know, in days past, you know, oftentimes we would encourage people, we would look up to people who could come into work just a little sick and make it through the day, push through the day. This year, last year, that we're not in that same ballpark anymore. We are requiring any student or staff that is feeling any side of illness to utilize the flexibility to stay home. Face masks or face coverings are required in all of our schools, and that is a requirement of the California Department of Public Health. So anytime vaccinated or unvaccinated individuals are indoors, all of our schools are required to participate in face coverings. We are also recommending that those face coverings be utilized outside, and many office staff. So basically everybody that works in that educational setting. Our school nurses are taking up this challenge of how do we weekly test each of the individuals in our schools, our staff members in our schools, who have not yet been vaccinated. LCOE, County Office of Education, has set up a team to go out and support our school districts that do not have school nurses with that testing requirement. So while LCOE also does not technically employ a school nurse, we have some health pathway classes, nursing classes in CNA and medical assisting, and I thank our teachers in those classes who have stepped up, along with some of our MA graduates, our medical assistant graduates, to implement this testing program. And then we are encouraging vaccination for all students 12 and up. And I want to remind everybody that the Pfizer vaccine is now approved for everyone 16 and over. It is still authorized for emergency use for those that are 12 through 16. So, in partnership with Public Health, Lake County Office of Education has also utilized our same staff to put together a vaccination team, and we've conducted vaccination clinics in most of the high schools throughout the county, and we continue to be available at the request of school districts to engage in outreach to vaccinate our students. Now, while we are targeting students with those vaccination clinics, we are not limiting vaccination to just students. Anyone who shows up there will receive a vaccination. In terms of our facilities, the schools are continuing to sanitize on a daily basis. We continue, was implemented early last year, a fogging schedule where we have backpack foggers and go through the classrooms utilizing a botanical that's designed to neutralize viruses. The static electricity causes it to be attracted to flat surfaces. The flat surfaces are all fogged, and that neutralizes the virus that may exist in our classrooms and our office spaces. Plexiglass dividers continue to be utilized for those that wish to utilize them. Many of our schools have implemented access points to enter the campus so that all students may be screened before coming on, in addition to utilizing technology where parents are having to attest to the wellness of their children before they come to school that day. I briefly mentioned the HVAC systems, but I think it's worth mentioning that the ventilation upgrades were able to move forward at this point in time because our school districts made a commitment 4 years ago when smoke days started to impact us in Lake County. And by smoke days, I mean days when districts were unable to serve students because of unhealthy air quality. So at that time, we made a commitment as school districts to figure out a way where we can continue to serve children under the premise that our classrooms can be as safe or safer than students staying at home on a smoke day. Now, that doesn't mean that there would be a lot of outdoor activities. As a matter of fact, there'd be no outdoor activities, but our classrooms could be as safe. So we began the process of upgrading our HVAC systems to HEPA or MERV 13 or better at that time, and utilized last year to finish that process. In addition to the HVAC upgrades, all of our school districts have purchased supplemental, standalone HEPA filters that are in each of our classrooms and each of our office spaces, and they're running 24/7. So that ventilation piece is key as one of the many mitigating factors to support or to eliminate the spread of COVID in our schools. Again, I would like to thank our teachers and our classified staff for helping to implement this safe and transparent return to school. So, that's a little bit about the schools. Let's talk about the students here for a second. So under guidance from California Department of Public Health, we have shifted the way that we are working through COVID cases when we have a positive case on campus. Last year, the 2021 school year, we would have shut down the school or shut down the classroom if we had one positive case show up in that classroom. This year, there's been a shift or a change in how we're moving forward. And that shift is that instead of closing the classroom, we're isolating the student who has tested positive or staff member that has tested positive. So if a student tests positive at school or their family reports that they have tested positive, that student is to remain home from school for 10 to 14 days, and during that time, they will be enrolled in the independent study program. And remember, the independent study program for younger grades includes daily synchronous online instruction. For the middle school age students, it includes weekly synchronous online instruction. And for high schools, it's much more of the traditional independent study, self-paced model. Those students may not return until they have been asymptomatic for at least 24 hours, and a report is generated to public health regarding that positive test. We then implement contact tracing, which will bring me to the next question of, so what happens to the students if they are determined to be in close contact through that contact tracing process? And this is where it gets very, very confusing and challenging. We have developed a flow chart, I didn't bring it with me today, that we utilize within our agency and we share with our school districts as a guideline as to how to work with our close contact students. So, first of all, if the individual in close contact has been vaccinated and they remain asymptomatic, they may return to school and they will be monitored daily for symptoms. If they develop symptoms, they will be isolated and/or we would implement a testing protocol. If the close contacts were both masked, the students would also be isolated for 10 days. But districts have the option of implementing what is referred to by CDPH, California Department of Public Health, implementing what's called a modified quarantine. Under the modified quarantine, the student may stay in school if they are asymptomatic. They are required to mask at all times, including outdoors. They must undergo twice weekly testing during the 10-day quarantine period, or what would have been the quarantine period. And they may not participate in any extracurricular activities, including community activities. So not just school extracurricular activities, they would be excluded from all community activities. Now, I'm simplifying a little bit because there is a way to reduce that 10-day notice to 7 days of quarantine, but there's quite a few hurdles to jump through to get there, and I'm not really prepared to talk about how to reduce that to 7 days. Many of our school districts, because they lack the ability to enforce what a parent and a student does in the community, are not utilizing the modified quarantine process. They are taking a much more conservative stance and having students serve, that's not the word I want to use, having students isolate for that 10-day period. Now, if you are unvaccinated and not wearing a face covering during that close contact, you will isolate from school on independent study for a 14-day period. And there's no ifs, ands, or buts about that. So there are some struggles that schools are facing as we roll into this new school year. Some were to be anticipated, some are, I think, a little bit of a surprise for us. The first one is that statistically, every day, students will test positive for COVID-19 in this county. And while I'm not a doctor, and I'm not the one that is going to make the call on this, the research that has been presented to me by Department of Public Health and by our local Department of Public Health is that the spread of COVID amongst children is still primarily seen in situations outside of school, and that we're not seeing a spread within school. But because we are testing and because we are taking close observations of symptoms, many of them are found in school. Positive cases are identified in school. The concept of students testing positive scares many people. And I think what we need to do is we need to de-escalate the fear of COVID from catastrophic to really truly manageable with appropriate medical support. Because we can manage COVID and we can manage the spread of COVID by putting in place safety protocol and by making sure that we address things quickly and appropriately. Another item we're struggling with is that all of this work, all of this effort takes additional staffing. And we are facing this additional work and trying to increase the staffing at a time when both our teaching staff and our classified staff are experiencing a retirement bubble. Our workforce is a senior workforce, and they are retiring at a faster rate than we're able to sometimes fill those positions. So we're struggling to hire both classified and teaching staff at this point in time. We are seeing a growing and oftentimes or sometimes unanticipated growth in enrollment. So while I've been citing for the last 7 years Department of Finance statistics that show Lake County as being either the fastest or second fastest growing county expressed in terms of student enrollment, when we're struggling to hire, growth is a problem to deal with. Where we see unanticipated growth is because of distance learning. Many families moved to Lake County during this last school year, but never took the time to enroll their child locally because they were already engaged in an educational program through the district they were in. And you can do distance learning from a school in San Francisco while living in Lake County just as easily as you can do distance learning while enrolled in Lake County and living in Lake County. So many families chose to forego the stress of changing schools in mid-year and wait until the beginning of the school year to enroll their child locally. And the other big issue that we are struggling with is broadband infrastructure and the lack of connectivity that our students and families face, both for financial reasons, but the schools are taking care of those financial reasons this year and into the next couple of years, but the schools don't have the ability to address the infrastructure issues and the lack of connectivity in the homes across Lake County and the regions across Lake County. So, as I think I've said a couple times now, our independent study programs require synchronous online instructional activities. So we are required to somehow breach that infrastructure gap that exists with broadband. So with that, I will open this to any questions you may have.
Thank you very much for all the information you've provided, not just to us, but to the public. I think what happens in our schools is important to all of us, so this has been a great conversation so far. Opening it up for comments or questions from the board. Supervisor Pyska.
Thanks for coming here today, Brock, and thanks, we really appreciate your diligence over the last year and a half with this. Just for clarity, each district has their own set of COVID protocols that are based on the guidance from California Public Health, is that correct?
So, you know, the governmental structure of school districts is confusing. People envision that there's this hierarchical structure between the district and the County Office of Education, and then the County Office of Education and the State Department of Education. And that is not the case at all. Each school district has their own governing board, and that governing board is ultimately responsible for the operations, the day-to-day operation, or I should say the operations of the school district, and the superintendent then becomes responsible for the day-to-day operations functioning under the direction of the board. So yes, each board may develop somewhat different protocol as long as it fits within both the local and state Department of Public Health guidance to operate under, yes.
So one of the issues that's come up this week, and we've spoken about it, is the lack of rapid tests in some of the districts or one of the districts, and potentially throughout the state and country. And so if parents are looking for a way to get their children tested, to get them back into school, or for any other reason, what's your recommendation on how they obtain a test?
You know, I should have addressed that question. Thank you for bringing that up, because just as I walked in here, I got confirmation from Rob Young, who is the Emergency Services Coordinator for the County Office of Education. And again, this is a big thank you to Lake County Public Health. They have been able to come up and fill the requests that our school districts have during this shortage of quick tests that exists throughout the state of California. For those of you who may not be aware, the supply chain has been divided in support of schools. Schools can no longer receive direct support through their local public health office for the supply of testing. They must now register directly through a partner program between California Department of Public Health and California Department of Education. And while we were in that transition process, the supply chain of, well, I guess I will say, there was an error in the inventory numbers that existed at the state, and so the state did not reorder all of the supplies that were needed to now implement 2 chains, logistics chains for COVID testing. So we're experiencing a delay of 4 to 6 weeks in terms of COVID tests coming down from the state, and so we are limited to what's on our shelves, and right now local public health has helped fill that gap. So our schools should be able to test. Rob Young is driving those tests around to all of our school districts today.
Oh, that's excellent. Who is paying for those tests? Are the districts on the line individually for those tests, or how is that working?
I'll say the districts are not paying for the tests. I believe, and I can't tell you how local public health is paying for them, but I believe that the state has set aside funds to pay for those tests.
For schools?
I know through the school's supply chain, there is also no cost for the school districts.
Okay, great. So one other question
Can
about...
I?
Oh, sure.
I'm sorry,
Go
I
ahead.
just had one more thought on that. That doesn't mean there's no cost to the school district. There's still all of the costs for implementing coordination and procedures that follow, and the follow-up procedures that go along with it. So, but the tests themselves are free.
And so is parental consent required for testing on campuses of students?
Parental consent is always required for any testing of any student. So if districts are choosing to utilize that modified quarantine process, they must get parental consent before they administer the test of the student. If the student and family choose not to consent to testing, then they would just have to revert to the 10-day of quarantine.
So my last question is about siblings and families. So if we know that there's a positive case in a family, how does that affect different siblings that attend different campuses?
Well, through the contact tracing, we're able to identify if a student tests positive or is identified as being positive. That contact tracing typically would identify that all the other siblings were in at least close contact. They may not be positive, so then we would implement that close contact protocol in terms of isolation and or modified quarantine.
Okay, thank you. That's all I have.
Thank you very much for your questions. Any other comments or questions? Supervisor Simon?
Yeah, just a follow-up on kind of Jessica's, a positive test in the household. Can the whole family get a test or just the student at the school?
At the school site, only the students
Okay.
will receive tests,
All right.
and staff.
All right, thank you. And then the other question I have is for the athletes that we have in school this year and the modified protocol for the quarantine. I just had a follow-up because the way you understood it is if they go on the modified, they can go back to school, they can attend school, but they can't do any extracurricular activities.
Correct.
And just drawing that line, obviously, because when they come back to school, they're still going to be in the lunchroom, obviously, right? Able to eat lunch with the other students and those types of things. So just wanted some clarity because that 10-day or 14-day, for some of the student athletes, that could be, cost them, a third of their season or something like that. If there's any opportunity, I just bring it up when you just want to understand it a little bit, being obviously a coach here in the county and understanding those protocols.
And I too was a coach, football coach, athletic director, swim coach, lacrosse coach. This is one of the unfortunate situations around COVID. And the guidance that we're following is the guidance that is put out by the California Department of Public Health. So we in education do not possess the qualifications to really change the guidance that they have put out. So in order to protect the district from liability, as well as the administrator from direct civil liability for failure to follow what has the effect of law, which is a public health order, we are recommending that districts follow the guidance that's put out by California Department of Public Health. The struggle becomes the messaging piece of this, because the messaging piece of it doesn't make sense to necessarily say your student's safe enough to come to school, but it's unsafe for them to participate in all of these extracurricular activities. So I can see that crossed messaging or that mixed messaging element to that. And I think that's one of the reasons that some of our districts have chosen to not implement the modified quarantine process and just have every student stay home from school as well as extracurricular activities for that 10-day cycle. What was I going to say? The piece of this that I think is key is that, as that kid in high school who was motivated to go to math, English, science, and social studies because I knew at the end of the day I was going to get to the weight room and then I was going to get to football practice, this is not the messaging that we want to give. But this is the messaging that we are required to put out there and we are required to implement.
And I want to thank you for answering that, Brock. My question comes from the point of understanding that these are mandates that are coming down from the California Department of Public Health and that our local officials obviously understand, but as we are, just as a board too, there are things that come down that we have questions on and don't quite understand all the time, but we'll implement and follow those. As you said, with the liability question and others, I just wanted to ask that question, and it's back on me to, as a leader in the community, to reach out to the state level, because I know we had this somewhat issue last year when there were potentially going to be sports, and I think the big controversy was whether or not there would be cheerleaders on the sidelines for the games, and I know that that was eventually changed just at looking at some of those protocols. So anyway, I thank you for answering the question. I wanted that clarified also, that is not something that a local decision here. It came down from the state, and we've got to work through that process for our kids and our athletes to keep everybody safe. So thank you. That was my questions.
Thank you.
I just have a follow-up on this point. Is that okay? Is yours a follow-up?
No, go ahead.
Oh, so is there any differentiation with athletes and extracurricular activities if you're vaccinated or not?
Good question, and there is the ability to differentiate how you work with students who are vaccinated in terms of extracurricular activities. They may continue to participate in extracurricular activities if they were in close contact and they were vaccinated, fully vaccinated.
Good question. Thank you.
Yeah, good question for that, because actually that is not the message that Lakeport Unified is sending out. And that was part of my question, was messaging. I thank you today for coming out and giving this information to us, but I know for myself as a parent with students at the high school at Lakeport Unified, we need to do a better job at messaging. And I don't know how it is with the rest of the school districts, but this information that you've given today, I only knew some of it because I had contact with a principal or a superintendent, or I contacted a school board member to fully understand what the protocols are. And I think our school districts need to do a better job at their messaging so we can fully understand what the protocols are as a parent. So when you get that call from the school that your child had a close contact with a positive case, the school district doesn't ultimately ask you if your child is vaccinated. They're waiting for you to tell them. But if you don't know to tell them that your child is vaccinated so they can stay in school, you don't know that information. For myself, my child stayed home from school for a couple days because he had a close contact. I had no idea that the fact that if he was fully vaccinated, he could have continued to stay in school. Mm-hmm. So I think we need to do a better job at messaging in our community with our school districts.
I want to make sure I don't overstep my authority. Obviously, the school boards have the ability to make more restrictive requirements than the California Department of Public Health guidance. but the California Department of Public Health guidance does allow for vaccinated individuals to continue in their extracurricular activities.
Thank you, bro.
Supervisor Crandall?
Yes, and of course, after you said that, I think this might be part of my next question is situations where families decide they don't want to vaccinate, they want their whole family to vaccinate, or vice versa, where the family feels completely unsafe in sending their child to school because of the opposite. Are they given the opportunity to conduct an independent study? And I think you might have answered it, but I just wanted to kind of like highlight.
Yes, every family is given the opportunity to participate in independent study. They do not need a doctor's note. They do not need anything that says this child should. It's not a matter of should, it's a matter of does the family choose to participate in independent study. Now, we are required to implement re-engagement plans for those individuals that are not engaging in their instructional opportunities through independent study, but at least for that first piece of it, every child and every family has the right to request independent study and receive independent study.
Thank you for that. And with that, my question really is, how is truancy being dealt with in this situation, or is it kind of like something where...
That is a real struggle that we are working our way through. You know, this is probably not the time to be overly aggressive in terms of addressing truancy, but really focusing on strategies to engage attendance. And there's a difference between truancy and attendance. So Lake County has a truancy problem, and when we, even before COVID, and when we look at our student attendance figures for our first, second, and third graders, and I always pick those grades because those grades are typically not choosing to cut school, our numbers are amongst the lowest in the state. So how do we balance that truancy problem with what is now an attendance and engagement problem because of the complications of COVID is a complex conversation that does, at this point in time, I think really has to focus on re-engaging families, re-engaging students, and in the long term, partnering with our district attorney's office to re-implement a truancy program at some point in the future.
Thank you.
Thank you, everyone. I just have one simple question. Actually, it's a two-part question. We've kind of touched on the vaccination, and I'm hoping that you can provide maybe some numbers. What is our student vaccination rate for 12 and up, if you have that? And also, what is it for our staff? And what is the strategy for future vaccination clinics? I know we've worked on the mobile vaccine clinic. Is that something that's you're a part of those conversations on getting access to those mobile clinics? Just kind of curious as to what the strategy is to make sure that it's available as much as possible.
Supervisor, that's a lot of questions in one question, so I'll try to remember them. First of all, the percentage of students that have been vaccinated is roughly 20% of students have been vaccinated. Our numbers in Lake County are lower than the statewide average, significantly lower than the statewide average, and if we look at some of our comparison counties, particularly those along the coast, where we're seeing vaccination rates of students in the 80s, 85% at this point in time. So it is obvious to us that we need to do a better job of getting our children vaccinated, really our teens vaccinated at this point in time. The question around staff vaccinations, we're just wrapping up the mandate for staff vaccinations came down a couple of weeks ago. We're just wrapping up the count on that at this point in time. We're seeing a range of anywhere from, in our districts, anywhere from 70 to 80% of staff are vaccinated. It should not be an overly burdensome process to implement testing for the remainder of the staff that have yet to vaccinate either, many of those staff are in a situation where they cannot vaccinate, and we're going to have to continue testing throughout this pandemic. The next piece of the question just slipped my mind. What was the follow-up
The
question?
strategies for vaccination clinics, and if you are involved with the conversations of the mobile clinic, as I think that would be really useful to be able to mobilize in specific areas where it's needed.
You know, I'm not going to overstep and say that we're involved in every conversation that public health has. I can't address that particular piece. I know we've had conversations with public health along those lines. You know, we are now to the point where we're back into the school year. We are seeing cases develop amongst our teen and our child population. And I think at this point in time, families may be more willing to engage in vaccination clinics. So I do believe that we as school leaders need to become more aggressive in making sure that we have clinics available for our families to access.
Thank you for that. And I know that it was brought up about the different school boards and the school districts and having their own local government for those specific students. I think that's what makes it difficult. I think throughout the state of California, already each county kind of had their own subset of rules of what you're expected to do when you cross the imaginary lines into another territory. Same thing for school districts. It makes it confusing when they're not all forced to follow one specific set of rules. They can create their own. And I think that's what makes it really confusing for proper messaging. And so it is important for each school district to make sure that their messaging is very clear to the people that they serve. But I think that's the difficulty of it all is the way that our government is set up, it really comes down to the local jurisdiction to make sure that our messaging is as strong as possible. So that is a difficulty that I think we're never going to end with. We just need to be better at it and continue to strive to be better at it. Any further comments or questions before we open it up for the public? Let's go ahead and open it up for the public. Any comments from the public on this COVID-19 update? Let's go ahead and unmute Jeremy Rarick. Sorry if I said their last name wrong. Please give us your name, and you have 3 minutes.
Oh, can you hear me now?
We sure can.
Okay, perfect. Let me start with a comment a local teacher made online. She said, "I wish parents that don't vaccinate would just have the shot put in their heads, put them out of their miseries." Another teacher at Middletown Middle School said, or screamed at her student to not take a drink of water in class. So what I want to do is look at the facts, what the facts are in Lake County. Lake County, COVID's been around for 18 months. There's 65,000 residents in Lake County. There have only been 4 COVID deaths for folks under 50 years old. Only 4 in 18 months. And only 14 under 65 years old. There hasn't been a single death of any child under 18 years old, not one. But the board is pushing these children and young adults to run out and take an experimental vaccine that has been proven to cause heart inflammation, blood clots, neurological disorders, and death in that age group. World-renowned doctor and epidemiologist Dr. Peter McCullough was an advocate for the vaccine in January. He has performed countless peer-reviewed published studies over the past 30 years. When his patients started having severe side effects, he changed his view and recently said, quote, "This is far and away the most lethal, toxic biological agent ever injected into a human body in American history." I believe him, but it's not just him. Many doctors, including my own local doctor, have quietly advised me not to get the vaccine. Why would I risk it for my age group? The common flu is far deadlier than COVID for that age group. This has become a mass hysteria, and the board is spreading this fear for political gain. It's kind of disgusting what you all are doing. You have children masked in schools, even though science doesn't agree with you. A 2015 peer-reviewed study showed that not only were cloth masks ineffective, but they also increased viral transmission because of contamination. Do you think 4th graders are necessarily taking precautions to prevent contamination of their masks? Of course not. That means you are actually increasing young students' risk of viral transmission in Lake County. Another extensive peer-reviewed study out of the University of Louisville showed the same results. They concluded that masking indoors requirements had no measurable effect on COVID-19 transmission. So why do you continue to support the anti-science position of forced masking young children? You could care less about the psychological or physical damage that you are doing to our kids. For me and the hundreds of parents that I represent at Unmasked Our Kids Lake County, this shit ends today.
Thank you very much for your comments. Next, we have Darylyn. Again, if you could provide your full name, and you have 3 minutes.
I'm Darylyn Tharp. I completely agree with what Jeremy said. It's all valid and provable. But also, I would like to know, clarify this. Did you say that students that are vaccinated are not required to get tested, but students that are not vaccinated are required to get tested?
And if you can finish your comments so we can get to that answer, that way we can...
Okay, then my comment is, why would they discriminate against the people who have not been vaxxed when it's proven that the vaccine does not prevent transmission? It was not even designed to prevent transmission. So why discriminate against the non-vaxxed? Thank you.
Thank you very much. Superintendent Falkenberg, if you would like to respond to that.
First of all, I'd like to indicate that it is not our local board's decision. This is California Department of Public Health mandates that we're following here. In regard to required testing, no student is ever required to test. It just changes the protocol as to how we can move forward with each student. And there, you are correct, there is a differentiation in the California Department of Public Health guidance on how to work through situations when students have been vaccinated as opposed to situations when students have not been vaccinated. So, you know, I choose to use a different term than you do, but it is a differentiation in processes.
Thank you for that. Next, we have Julia Bono.
Hello, can the board hear me?
Yeah, if you can maybe speak a little bit louder.
Okay, I'll try. Is my video feed available?
No, but if you can provide your name and then you have 3 minutes. We don't do video feed on the Zoom.
I have an exhibit to show before the board. I've noticed that other individuals are able to show exhibits. Would it be possible, please, to
I
show
don't
my
know
exhibit?
of any other individual that's had the ability to show an exhibit on Zoom.
Yes, your advisors have showed exhibits.
Okay, this is public comment.
She's wasting.
All right, okay, so if you won't see it, I'll send it to you.
Please.
Okay, my name is, can I start my 3 minutes now?
No.
Please get started.
Okay.
Sorry.
My name is Julia Bono. Although the board and its advisors seem notably in favor of promoting widespread vaccination against COVID-19 to county residents, I would like to draw the board's attention to the questionable effect of vaccines on the number of COVID-19 cases. According to data compiled by the CDC, COVID-19 cases reached their peak in early January 2021. See the graph shown in my video feed, which you're not showing. The CDC's data shows that by January 8th, over 300,000 new positive test results were being recorded daily in the United States, although by February 21st, that number had fallen dramatically by 82% to just 55,000. COVID-19 vaccinations were granted emergency use authorization in late December 2020, but just 5.9% of Americans were fully vaccinated by February 21st. Clearly, the COVID shots had virtually nothing to do with the notable decline in positive test results. The most sensible explanation for declining rates of COVID-19 therefore appears to be natural immunity arising from previous infections. Evidence for this is a study by the National Institutes of Health that suggests COVID-19 prevalence was almost 5 times higher than reported due to typically mild undiagnosed infections. I'm linking the link to you. Even the CDC notes that the available vaccines have not been that effective. It states on its website in late June, the 7-day moving average of reported cases was around 12,000. On July 7th, the 7-day moving average of cases reached over 60,000. This case rate looked more like the rate of cases we had seen before the vaccine was widely available. I've also linked that to you. Secondly, I would like to mention the value of natural immunity to COVID-19 versus vaccination with an mRNA vaccine, such as the Moderna vaccine and the Pfizer-BioNTech vaccine that recently obtained FDA approval for use in some age groups, although it remains under an EUA for those between 12 to 16 years of age. The SARS-CoV-2 virus contains 5 proteins that are recognized by the human immune system after a natural infection. But the mRNA vaccines currently available only code for one protein known as the spike protein, since it appears on the spikes that radiate from the central sphere of the virus. Since the mutation can readily occur in this spike protein, but far less readily in all 5 viral proteins, this means that natural immunity remains far superior to current mRNA vaccines that are easily made obsolete, as we've already seen with the rise of the Delta variant that can cause COVID-19 symptoms in fully vaccinated individuals. mRNA vaccines also have
3 minutes
potentially
are up.
harmful
If
side
you can
effects.
please finish up.
My own sister-in-law experienced after being rushed to the emergency room with a blood clot in her heart
If
shortly
you
after
can
her
please
second
finish
Moderna
up.
shot. She is now on 4 medications and has had to resign her
Your
job.
3 minutes
Her
are
adverse
up. If you could
reaction
please
to the
finish
COVID-19
up.
vaccine was reported to the CDC VAERS database by her doctors, and she remains under observation. Thank you
Matt-
for hearing me.
Thank you very much. Let's move on to phone 1113.
Yes, thank you very much. This is Dr. Will Tuttle, and I'm speaking on behalf of the children, really, and all of us here. I think that the point is, the great journalist and writer Upton Sinclair summed up the situation, I think, very well. He said, the hardest thing in the world is to try to get someone to understand something when their salary depends on them not understanding it. This is the situation we're facing right now, I think, with the health director, with supervisors, the superintendent, the media, Lake County Record B. All of your salaries depend on your not understanding the devastating impact of the policies you're implementing and the destructive fear-based narratives that you're promoting. This was true also of Dr. Swaminathan, the World Health Organization chief scientist, who claimed the same thing that Dr. Gary Pace claimed last week, nonchalantly said that ivermectin is ineffective with COVID. So fortunately in India, Big Pharma doesn't completely monopolize medicine as it does here, and there was a whole movement of tens of thousands of holistic doctors in India who knew that ivermectin is very effective and made it available to the people with great success. And so of course we hear none of this in our pharma-controlled media here, but now Dr. Swaminathan is on trial in India for deliberately misleading the Indian nation about the benefits of ivermectin, causing countless deaths and suffering, and she's actually facing the death penalty for that. So maybe now she's willing in her heart to understand something, that she was merely a puppet and a parrot for the most criminally corrupt corporations on planet Earth, and that she and the policies and statements that she was told to make were directly destroying lives. The same is true here, I think. These are not my opinions. These are really the facts of the situation. We have, if we have tribunals here eventually and the truth comes out, then perhaps people like the health director will be similarly held accountable for deliberately suppressing information about alternatives and also for deliberately refusing to investigate the devastating impacts of the vaccinations. There's something called the principle of lesser magistrates, which is the obligation that local officials have to protect the local people from tyrannical directives that come from the state and federal level. We need to be protected from them, and you're really responsible for that. So similarly, you, local government officials, could be also held criminally liable for your behavior for blatantly failing to question the pharmaceutical narrative, taking away our constitutional rights and the rights of our children, wrongly extending states of emergency, promoting the injection of deadly and harmful chemicals, and thereby contributing to the killing and injuring of people in Lake County. All of these procedures you're mandating are devastating to our health and on every level. The children have a 99.998% COVID survival rate. Their risk of death is similar to being hit by lightning. Why are you targeting them with these toxic fear and masks and so forth? So every time we have a moment of silence for someone who has died of COVID, who should
Your
we
3
be
minutes
holding
are up.
accountable?
If you could finish up, please.
Okay, I just want to say our conscience is our greatest ally, and hopefully we'll use our conscience to realize that it's not justifiable to refuse to understand just because our salary depends on us not understanding. Thank you very much.
So I'm going to pause for a second. I feel like I have to say something. It saddens me that we are arguing on things that I just believe are blatant, just obviously wrong facts. They're not facts at all. They're just straight up lies that people believe. The data proves otherwise, but it's sad to me that we ignore that there was almost a 20% increase in deaths in the entire United States in the last year, and 400,000 people died from something before a vaccine was widely available. And yet here we are fighting over the vaccine, which, if you look at all the data, the people in the hospitals and the people who are dying in large numbers are not the people who are vaccinated. Yes, eventually when 90% of the people are vaccinated, we're going to start seeing larger numbers of people who are in the hospital that are vaccinated, but people are not going to be hurt in the same amount as what it is right now. You don't hear of refrigerator trucks for people dying from the vaccines. You hear about that at our hospitals right now that are overwhelmed. That's what's going on in the South as we speak. I'm just, and Del Norte. I'm confused why we can so easily ignore 400,000 people that died in 2020 when the vaccine was not available to the public. It's kind of disgusting to just ignore that, like it didn't even happen, and those people didn't matter. And your rights aren't being taken away. You got your 3 minutes. Everybody gets their 3 minutes. You want more than 3 minutes, run for office. And nobody else is taking your rights away. Nobody's forcing you to do anything. This rhetoric is dangerously disturbing to me. And you talk about humanity, but you're ignoring the deaths of so many other humans. I find that inhuman as well. So I can't continue that rhetoric without pausing and making those statements, because it's just truly disturbing. Next. Phone 6478.
Very well said, Supervisor Sabati.
Hi, can you hear me?
Yes, we can hear you. If you could please get your first and last name, and then you have 3 minutes.
Yes, my name is Madeleine Buehler, and I like to utter my concern, deep concerns about the kids who should be now vaccinated, because there is 99% of non-cases for kids. They're immune to it. And now they get all vaccinated and treated like elderly people and middle-aged people. And this is emotionally very, very heavy for them. And we just really push them into their death. So many have commit suicide and are forever sick and ill from these emotional pressures. And the little babies don't even ever see the mothers and friends' faces because of the masks. And I mean, it's such a disaster with all that lockdown, masks, and vaccinations, which aren't vaccinations, they're shots, and they're very dangerous. And I think you don't have to follow the orders of the state, because if the state tells you to jump over a cliff, you won't do it. I mean, why do we all obey to these non-science commands? I think this has to really stop, and I understand all these parents who are frightened with their kids about all these obligatory movements they do, and they disinfect with chemicals the whole school. And I mean, this has to stop. Thank you.
Thank you for your comment. Phone 2689. Please provide your name, and again, you have 3 minutes.
Can you put it on lab?
Hello, this is Christina Robertson. Yes, it is very disturbing how many deaths have occurred since COVID-19 was announced, due to the refusal to implement early treatment. That is our only hope forward, is implementing early treatment with drugs that have already been approved by the FDA, safe drugs. Some people may not need them, but others may. I know a person who was sent home. He went to see medical. He wasn't sick enough. They wouldn't see him, so they just sent him home. And what did he do? He went into, I believe he just went into some kind of a shutdown. He wasn't taking care of himself, drinking water. It made him tired. He slept and went unconscious, and well, he died. They also forced that they didn't know better, because I don't think the hospital staff knew better at that time. They should know better by now, not to be putting people on ventilators. That's not the appropriate treatment. So that's not really what I wanted to say, but that I had to respond to. Yes, it's sad that all these people have died. We are upset about it. Don't think we're not. But it's also tragic that the people in influential positions are following orders, just following orders and marching our world forward to a totalitarian government. It's really time for you to look at the world news, not just the whatever news you're looking at. Look at some of the doctors, researchers who are absolutely world class. Look at it. Look at the research that's being done. This is an enterprise. This pandemic that only global vaccination can end, this is an enterprise that will create more wealth for some and more sickness and death and poverty, economic devastation for others. So it's really time for you to stand up and kind of look at the information that's really out there and even risk your jobs. You can always file a lawsuit yourself. But this is time, really. There's too much information out there. You've got to look at it. And children should not be getting the vaccination. It has been shown that their hearts, that it causes heart damage to children. They should definitely not be getting this. And the people who are dying
Your 3 minutes are up.
Already,
If you can please finish your comment.
They have comorbidities. They're elderly. All right, thank you for hearing.
Thank you very much for your comment. I see nothing further in the Zoom room. Anything from our board chambers for this agenda item? And seeing none, bringing it back. Any further comments before we close up?
Just one comment from the last speaker there, and we said we need to stand up. I truly believe. I think I've said this multiple times. I myself and I think this board are standing up and doing what we need to do. Sometimes doing the right thing is very hard and very challenging. And I come from a point, as we talked, I said I got the Moderna vaccine as soon as it was possible. I know my family did, and encouraged them to do that. They can make their own decisions. But standing up for our communities and doing the right thing is not always easy. In doing that, it always jeopardizes. Been threatened right here about a recall and other stuff on this diocese. But I truly believe that we are moving in the right direction. We are looking to push towards the right direction for humanity. And this is a pandemic that is real, whether you want to believe it or not. And we'll continue to work on that, in that direction. So when you say stand up, we're doing it. That's why you call in every week with misinformation and misguided, words over the Zoom or however you're doing it. But we are standing up. And we'll continue to do that. So just want to make that point.
Thank you very much. And I think that the point, no matter what institution we're talking about, is about keeping people safe. It's keeping kids safe. It's keeping their families safe, because kids do not just go home to a boarding school room and board, they go home. And a lot of the kids that I know are in the area of Clear Lake, they have their grandparents taking care of them. They have their uncles and aunts taking care of them. They have elderly people taking care of them. And what happens in our schools eventually comes home to our homes. And it's so much more than just one individual. It's about the community. It's about the greater good. And everything points in the direction that we are not going to be hospitalized and we are not going to die at the rate that we've seen. And we're already seeing that decreasing. Our first surge, we had a 1.7% death rate in the county. Now, in the last 30 days, it's at 0.8%. We are reducing that because we are better protected and we are seeing those numbers drop everywhere. It's a matter of what are we using for the protection and is it working, and everything points to yes. And so nobody's forcing anybody to do anything, but we got to stop looking for the alternative facts that just work for what it is that our view is. We have to look at what's happening in our hospitals. We have to look at what's happening right here in our local area. And in our local area, 9 out of 10 people in our hospitals, sometimes more, are unvaccinated. And we want to protect those people. We don't want to ostracize them. We don't want to make them look like they're less of a person in our community. We want to protect them, which is why we keep talking about vaccination and helping to protect everyone that we can. It's as simple as that. We're all connected. It's not just about schools. It's about everything. Superintendent Falkenberg, thank you so much for being here. Appreciate your time. You definitely filled in the hour and then some. You reached your goal. Any last words before we go ahead and close this item up?
No, I just wanted to thank you for the opportunity to present today, and should you seek any further information in the future, we are readily available to support.
Thank you.
Thank you, Bob.
So we are a little bit behind here. It is 10:25. I do want to take, we're going to take a 5-minute break. I need to consult with CAO because I know we needed to get to an item sooner than later, and I just kind of want to check in and see what that is. So we will reconvene at 10:30 a.m. Hello, hello. Hey, we're back. Is everything continuing smoothly for all the platforms we're on? Okay, just wanted to check in before we move forward. So it's 10:30, welcome back. We are going to pick up our 10 a.m. item, redistricting, public hearing number 1, introduction to the redistricting process. And this is sponsored by CAO Hutchinson.
So Deputy CEO Matthew Rothstein is going to introduce our contractor, Margaret Long.
And if you
who's here
can,
today.
please put your...
Sorry.
Thank you.
Hi, yes, this is Matthew Rothstein, Deputy County Administrative Officer. I wanted to thank you, Board, for taking up the previous item earlier this month to set our redistricting hearing schedule. I'm excited now to present Margaret Long and Carolyn Walker of Prentice Long, who will be conducting today's hearing. Thank you very much.
Good morning, and thank you for having us. If it's okay with the board, I'd like to share a screen and see if we can get our PowerPoint started so we can have a discussion regarding redistricting. As we discussed with the board prior, the process of redistricting requires us to have 4 public hearings. This is the first of the public hearings that we'll be holding. It was noticed in the newspaper, it was noticed on the website, and this is an opportunity for us to introduce the redistricting process. I know the board is familiar with it, but to introduce it to the public as well. I'm Margaret Long with Prentice Long. I've been coordinating with your fantastic staff this process. I have with me as well Carolyn Walker, who is an attorney for my office, who's been doing a lot of work on the public outreach components related to this process. So as we do with every public hearing we hold relating to redistricting, we just want to remind the public what this process is. Every 10 years, the census data comes out from the federal government that provides us information on the locations and number of individuals in our community. Once we receive this information, we are required to look at our boundary lines. So those are the districts that are drawn that the supervisors are elected into. We're required to look at them and make sure that they are accurate, meaning they are proportionate, they're appropriate, they don't divide communities of interest, they are federal and California law compliant. And so this is the process by which we go through and do that. The process is this, especially this year. So this is in 2010 when this came around, the laws were a little less inclusive. And what the state legislators decided since the last go round is that they want this to be more inclusive, to allow the public to be more involved. And again, this is the first hearing, which is the information to the public about how they can be involved. And the concept is that as we do this redistricting, it's important to get the public's input, looking at what they determine to be the community of interest, looking at what they determine to be appropriate groupings. So the Board of Supervisors, through these process, is seeking input from the public to come in and provide that information in whatever mechanism you want to. You have an opportunity to share with the board how you believe the lines should be drawn. You can provide that in oral testimony. You can provide that in maps that you draw yourself. The board and the redistricting committee accepts the information in any way you would like to provide it. There's an opportunity again for the public who is non-English speaking to be involved. The request should be made 72 hours if you would like some translation services provided. And we have an email set up through the county staff at redistricting@lakecounty.com, which again, you can submit any requests you have, any questions you have, or any input you have regarding this redistricting process. Because in 2020 and 2021, the concept behind this is to make sure the public has as much access to this process as they can and be involved and as they can and want to be. So again, going through the law, we're looking at AB 849, and we're looking at a bunch of different things. So when the public sits down to look at giving suggestions to the board about how to draw the maps, we do ask them to keep this in the back of their mind that we are looking at a number of factors. Primarily, we want the districts to be geographically contiguous, meaning we want them to make sure they're all touching each other. We don't want to have islands unto themselves, and the law does not allow us to do that. We want to try to the best of our ability to keep local neighborhoods or community of interest together. This is not always possible. But again, the best of the ability of the Board of Supervisors keeping those community togethers is what the law requires. Again, minimizing divisions, not creating islands, easily identifiable boundaries. So again, we try not to divide things in the middle of rivers, streets, highways, bridges. We try to kind of keep all those points and boundaries together as best we can. We try to keep them as much geographically compact as we can. So what that you always say is that, you see a lot of communities that have arms. So, they've got a little a point and then an arm or a tentacle going off. We don't encourage that, and the law doesn't encourage that. They try to keep it as close together as possible. And of course, we don't look at anything that's discriminatory. So we make a very distinct responsibility not to divide up jurisdictions based on the political preference of individuals in that district, race, anything of that nature, economics. We don't look at those factors. We try to make it very clear to the public that we will not be able to look at those factors. So the next hearing we're going to have, public hearing, is going to be talking about the communities of interest. And so again, we want to keep this in the back of the mind if anyone wants to participate in this conversation to understand what a community of interest is. So again, we're looking at trying to keep populations that share social and economic interests together. Again, looking at for single purposes. A lot of times you'll see these as special districts or cities. A lot of times you'll see them as shared facilities or shared resources. And looking at those, again, the definition, we provided some examples of that: transportation facilities, work opportunities. If they have a very common interest in a economy, that would be considered a community of interest. But we don't look at political parties. We don't look at the current supervisors' positions. We look again at what the geographic makeup is. So for timelines for this process, again, we are looking to get the delivery date of the census data from the federal government, September 30th. Again, California has asked for some time to be able to adjust it based on prisoner population. So they're going to go back and look at the federal data that's provided, and we're already getting federal data at this point. So I'm hoping California's deadlines will be pushed up as well. But California is looking to adjust it based on the home of the individual in the prison, not based on where they are currently housed. So they have to do an adjustment on that, and they're asking for 30 days. Maps are looking to be published on November 5th or slightly prior to that again, and looking to have a final adoption from the county at November 30th, because the deadline for us to get this done is December 15th, 2021. So how the county residents can be involved, again, we're going to be holding 4 redistricting public hearings. They're going to be available via Zoom. So we encourage the public to attend. This is the first one to provide the information on how to get access to it. The next one, again, we're going to be looking at communities of interest. We will be publicizing forms that people can fill out to kind of give us an idea of what they view as a community of interest. We'll be providing our suggestions and looking forward to comments on that. The November 2nd hearing, again, is going to be the hearing where we actually start looking at draft maps. This one's scheduled for nighttime so that the public can be more involved in it. We're looking at doing it on November 2nd at 6 p.m. So again, looking to get as much public as involved by doing this meeting at night. And this is, again, the one where the public can come in with suggestions on maps, and the board will actually be presented with maps that are drawn and suggestions so that they can start looking at the actual lines. The final meeting will be November 30th, and that's where we'll be adopting the final map. So again, between November 2nd and November 30th, we'll be working to take all of the considerations from the board and the public and presenting a final map for adoption by the Board of Supervisors. These are all available via Zoom, and again, encouraged to participate. So how can residents get involved? This is, again, the important part of this conversation today is that the Board of Supervisors needs you to get involved. We are asking that if you have any maps that you would like to draw, please submit them to the redistricting website you see here. The board and staff has also made a website. It is on the Lake County website under Government, Boards, Board of Supervisors, and Redistricting. So if you go onto the website and you go into Board of Supervisors, it is one of the tabs you can tab on to get in there. We will provide additional information there. We'll provide samples of the drafts, any forms that we submit, meeting minutes. That will all be on there. So if you have any questions related to that, that's a really good first place to go. Again, the public can also listen versus a bunch of different social media. And these videos will also be, they are recorded and they will also be available to view as well if you're unable to attend the meetings. So again, if you have questions, we encourage you to go to the website. That's a really good first place to go. It's up and running, already has great information on it. If you have anything you'd like to submit or specific inquiries, the redistricting at lakecountyca.gov is the great way to do that. And I thank you to the staff of Lake County. Working with Matthew has been an absolute pleasure, very responsive, very knowledgeable, and making this process go very smoothly. So I really am very appreciative of that, and IT and GIS staff as well. But again, the process works because we get people participating in it. So the goal of today is to encourage folks to participate, encourage folks to reach out with their thoughts and suggestions. It will all be considered. Everything is taken into consideration and looked at. And so we encourage you to do that. And thank you for the opportunity to do that quick PowerPoint. And I'm happy to answer any questions before we open it up for the public meeting.
All right, thank you very much for your presentation. Any questions or comments from the board? And so I do know that the federal government did a quote-unquote dump of a lot of data, and I tried looking for it. It really is not available on a local level until September 30th. That's where, because I think it was much more 30,000 view of 30,000-foot view of everything that's inside that data, rather than drilling it down to like the city of Clear Lake or city of Lakeport or things like that. Am I correct on that? That it is out there, but it's not available with that kind of specificity?
You're absolutely correct, Supervisor. It is a data dump is a great way to describe it. And we are hearing that they're going to continue to do that and provide it more information before September 30th, but the date we still have is September 30th. So we will, if they are gracious enough to give us the information ahead of time, and California is able to process it, we'll speed up our process as best we can.
Okay, thank you very much.
But we're still working out those timelines.
Okay, thank you so much. I do have a question, and I don't think it's within the purview of the contract that we have with you, so the question might be to staff. I think it's important for us to pay attention to the legislative districting that's also going to happen within the state, both for federal and for the state of California. What kind of level of scrutiny are we having on that? Are we in a group that is active in all of that? Because that's really important to us as to who our future representatives will be. I know we did write a letter saying, please keep us within the scope of Napa and Sonoma County with Mike Thompson. Just kind of curious of what level of participation do we have?
And so I'm going to defer to Matthew for that answer to that question. He's the staff person that has dug into this the most. Matthew?
Yes, and we've not been directly involved at the federal level to this point. We have certainly indicated to our representatives that we would like to be apprised of any updates, but we have not received any to date, and I can definitely follow up on behalf of your board.
And I'm taking it's probably similar timelines for all of the above than what we're dealing with locally.
Yes, very probably so.
Okay, thank you so much. Just something that I'll check in from time to time, just because I think that's a really important factor for us to make sure that we have the proper representation moving into the future. If there's no further comments or questions, let's go ahead and open it up to the public, both in the boardroom and the Zoom room. Any public comment? And I'm sorry that we haven't changed the final date from December 15th to anything earlier for you. I know from the Registrar of Voters perspective, it's going to be a tight window. And we'll just have to work together to make sure that that's as, I hate to say as simple as possible because it doesn't sound simple, but hopefully everything will be done in time so that it doesn't have to push your deadline a little closer. I see no hands up in either the boardroom or Zoom room, so let's go ahead and bring it back. And today was a public hearing presentation. There's no actions needed to move forward, but we do have our schedule of meetings that are coming up. And Margaret, if you can please let us know again when the next meeting is.
Absolutely. The next meeting, one moment, and I'll pull it up. I'm happy to go through all the meetings one more time just because I think that's very important information. So the next meeting is October 2nd. It'll be at 10 a.m. In the boardroom.
It's a Saturday.
That's where we're.
It's a Saturday.
It is a Saturday. So it'll be again done as a special meeting. And that will be the opportunity to talk about communities of interest. The next meeting is November 2nd. That's going to be our evening meeting. It'll be held at 6 p.m. And that is where we'll go over the draft maps. And the last meeting will be November 30th, 2021 at 9 a.m. In the boardroom. Again, a special board meeting. And that will be when the final map is adopted.
Thank you so much for going over all that. Perfect. Well, thank you very much for the presentation, and we'll look forward to seeing you again on October 2nd.
Thank you. Have a great meeting.
All right. And so with that, we're going to take a quick pause. We're going to go into closed session. I'm hoping that 10 minutes, 15 minutes maybe at the most. So we will reconvene. Let's just go ahead and give a little bit extra time. We'll reconvene at 11:10 into open session. And we will continue with item 6.4. And we are going to go into closed session to go over 8.3, public employee appointment pursuant to Government Code Section 54957B, 1A, appointment of Community Development Director. And with that, we will go ahead and go into closed session and again reconvene at 11:10 a.m.
Matthew, we're just doing a test to make sure that we have audio. Can you hear us in Zoom?
I can hear you in Zoom. Thank you.
Okay, thanks.
It's 11:10. Check, check.
Seems like the microphones are, oh, okay, they're on now. So Johanna, are you ready to go?
Yes.
Thank you.
All right, I got the thumbs up. It's 11:10. Welcome back. And looking at Ms. Grant, I need to ask if there was any action taken in our closed session. Okay, so asking if any action was taken during closed session.
None taken.
Okay, no action taken. Thank you very much. And let's move on to 6.4, 10:30 a.m. Consideration of response to the 2020-21 Grand Jury Final Report, and CAO Hutchinson.
Again, I'm introducing Matthew Rothstein, who will present this response.
Thank you and good morning again, Board. As you're aware, each year the Lake County Civil Grand Jury compiles a series of reports making recommendations to improve government systems, procedures, and methods of operation. The Civil Grand Jury's final report collects findings and recommendations based on their investigations. Pursuant to the California Penal Code sections 933 and 933.05, your board is required to respond to grand jury recommendations as requested. And staff have been privileged to work with your board to prepare the draft response that was attached to your agenda. And this response uses the grand jury's recommended format and includes answers to all recommendations for which a response was required. We recommend that your board acts today to approve the response and authorize the chair to sign. If you find that any changes are needed, those must be adopted no later than Tuesday, September 14, to allow timely submittal. Thank you very much.
Thank you very much. Any comments or questions on the reports that we were provided? So there is, I was reading through this and it didn't catch my attention until I was thinking about it later on. I believe it's on the collected departments report. And I know that there's specific answers. There's agree, already done, agree, will be done by a certain time, neutral, and then disagree. And maybe I don't have them exactly correct as far as what's available. And I'm looking through it, and I'm sorry that I just thought of this, that I feel like at one point they stopped saying agree or disagree, and I'm wondering if we need to make sure and label it. And I'm looking at page 12 and page 13. I want to say this is from Ms. Grant. Is it enough to, one of the response was, it says, it is presently being done and so has already been implemented. Obviously, that would be agree. Although an implied commitment seems amorphous, elected officials has already been implemented. Is there a way that we can add the response specific to, rather than having to try and figure out what the response is?
In the body of the county council.
Because it started out with the agree and disagree, and then eventually, as we got to the bottom of the document, it was more of an implied response based on the 4 responses that we have, and then, of course, the language. And was wondering if it's necessary to make sure that it has what is expected as far as those 4 responses, and then a verbal response, or if that verbal response is enough to imply which one of those it is.
I don't mean to step on anybody's toes, but I'm prepared to respond to that if that's desirable, Chair.
Go for it, Matthew.
Please.
Okay, so your board's response is required, right? So staff always endeavors to make sure that your board's response follows precisely the form that is required both in statute and the grand jury's recommendations. With the departmental response, those essentially function as background for the preparation of your board's response. We do include them so that the grand jury likewise has that background. However, your board's response is the one that must be compliant as to form, and it is as prepared today.
Okay, thank you for that clarification. But that's all I had on the reports. Appreciate the staff time for getting all of the responses. And also thank you to the grand jury for your questions and your concerns, and hopefully everybody learned a little bit more about our processes and a better understanding of how we're moving forward and what's being implemented and what's being worked on. Any comments or questions before we open it up for the public? Okay.
I would just add, Mr. Chair, that that we're off to a good start with this year's grand jury as well. They invited me over to give them kind of an overview of county operations, and they have lots of questions and interest in our work, so we look forward to the coming year with them.
All right, thank you for that. And so we have Bridget on the Zoom room. Let's go ahead and unmute Bridget, and please provide your full name, and you have 3 minutes.
Hi, can you hear me?
Yes, we can.
This is Bridget McQueen, and I'm just want to make sure you guys got my emails. This is in reference to the We the People report in the grand jury, and also the claim and the sewer. As you know, we have a lateral with, it's a public lateral with 50 homes at stake. If we don't take care of the sewer issue, we have the risk of the lake, and I know that your goal is to keep people safe, it's keep the lake safe.
Bridget, I don't mean to be rude and interrupt. I just want to make sure that we stay on the topic at hand, which is the response to the grand jury report. The issue and incident that you're discussing right now is a separate issue and incident that I'm sure we would love to discuss, but it's not on our agenda at this moment in time.
So it looked like it was on the agenda. When would be a good time for me to address this?
So you could always bring it to us during public comment that is not based on any item on our agenda. You can discuss it with your district supervisor and see if maybe that can be brought back to the board. But at this moment, again, you can discuss the response to that specific item within the grand jury, and if you have issues with the response, and which is what we're looking at right now, is the staff response and board response to the grand jury report.
So I'm looking at the staff response to the grand jury report, which was from Scott Harder at Special Districts.
Okay.
Is that pertinent or not?
And like I said, you can discuss, we are looking to file these responses today. And so if you want to discuss the response, yes, but discussing, we can't solve the issue today of what is occurring when it comes to the sewer and stuff, or the lateral, but the responses we can discuss to see if there needs to be any changes or anything like that.
Okay, well, I guess I want to ask a question. Did you get my email in response to Scott Harder's response yesterday? And do you have any questions to that? In that some of the inaccuracies that he had in his response and that he informed us, which was not true, and how I had to handle the spill, which was not my responsibility at all.
And so I believe that we all did receive the emails, at least I know I did. I'm getting some nods from supervisors next to me. Appreciate your feedback, and at this time, from my personal perspective, the evidence that has been brought to me leads me to wanting to continue with the comments provided by our staff.
What does that mean? You want to continue with the comments that the engineering report that you got that shows that it was intended to be on public property doesn't apply?
That's not what I said. I said I'm ready to move forward with the comments provided by staff on the grand jury report analysis.
Okay. Okay, so I'm going to work through with Tina on this because last time I emailed her, she was saying I need to talk to Anita Grant. So I'm just confused on how you want me to work with all of you to resolve this.
And I would say start there, and maybe it does need to lead to Ms. Grant. But at this moment in time, again, the issue itself will not be resolved today.
Okay.
And so please start there, and hopefully we can come to an understanding of what needs to be done.
Okay, great. Yeah, Tina, I'll be in touch with you.
Thank you very much. Any further comments on this item? Seeing none in the boardroom and seeing no more in the Zoom room, bringing it back to the board.
Mr. Chair, I move to approve the response to the 2020-21 grand jury final report and authorize the chair to sign.
Second.
We have a motion from Supervisor Scott, a second by Supervisor Simon. Roll call, please, Johanna.
Supervisor Simon?
Yes.
Supervisor Crandall?
Aye.
Supervisor Scott?
Aye.
Supervisor Pyska?
Yes.
And Supervisor Sabatier?
Aye.
Thank you.
Thank you very much. And again, thank you to all involved in getting this to us in timely fashion so we can get it filed. Let's move on to item 6.5, 11 a.m. item, public hearing, consideration of an ordinance extending interim urgency ordinance number 3107, 10 months and 15 days, which establishes a moratorium on the issuance of early activation permits for land use projects within the unincorporated area of Lake County, and authorized chair to sign. I do want to make a little caveat to this. This is not, I believe, and please correct me if I'm wrong, a moratorium on early activation. It's moratorium on early activation for cannabis. Is that correct? Because it does not say that in the title. It just says land use projects.
Should be on all land use projects,
Is it
correct?
all land use?
Early activation for all projects.
Correct.
Okay. If it's possible, please.
Is your introduction complete, Mr. Chair?
If we could please put the mask over the nose, please, and thank you.
Well, wait a minute.
Was the first moratorium cannabis-related?
No,
It was early activation for all early activations? Okay, thank you for that. Okay, that's where my confusion leads from. And so, CAO Hutchinson, please.
So thank you, Mr. Chair. Susan Parker is going to present the staff report, but before she does, I just want to again thank the ad hoc committee of your board that has been working with staff in support of the CDD department. They've had a vital role in getting this back to your agenda. We've worked with them every step of the way, and so I think they'll have a few comments after Susan does the initial presentation. Go ahead, Susan. Thank you.
Great. Thank you. Good morning, board. This public hearing provides your board and the residents an opportunity to consider an ordinance extending the interim urgency ordinance number 3107 for 10 months and 15 days. This ordinance extends the moratorium on the issuance of early activation permits for land use projects located within the unincorporated area of Lake County. Excuse me. On July 27th, your board adopted the interim urgency ordinance after considering the recommendation by the Community Development Ad Hoc Committee. That interim urgency ordinance took effect immediately upon its adoption and continues in effect until September 9th. At that meeting, your board made the determinations outlined in the interim urgency ordinance that included addressing the backlog of early activation permits and reviewing and or modifying the early activation permit process. As of August 26th, the Planning Division backlog included 145 cannabis use permit applications under review and 45 unassigned projects, 17 of which were early activation cannabis permit applications. And since the effective date of the moratorium, 2 early action permits that were in the pipeline have been issued. As required, the Community Development Department issued a publicly available written report 10 days prior to the public hearing describing the need to extend the moratorium. After careful consideration, we found that no immediate alternative was available. The impactful actions related to the outsourced professional services were deemed the most productive and have the potential for the most immediate impact. We have determined that there is no feasible alternative to satisfactorily mitigate or avoid the specific adverse effects identified as well or better with a less burdensome or restrictive effect, and with the adoption then the adoption of a proposed moratorium extension. And with that, I yield to the Community Development Department committee members, Supervisor Simon and Paiska. Thank you.
Yeah, we bring this back to you, obviously, after the approval. And we've worked through the process as a committee and concur with our interim community development department and director as we move forward with this, asking for the 10-month, 15-day extension. Let me get those dates exactly right. Yeah, the 10-month and 15 days extension. As we're working through the process, when we brought this for all early activation projects, we were looking to really give the community development department to really get a handle on where we're going here. As we knew, the numbers to be, it was overwhelming at this point, and we thought that bringing this forward would be the necessary need to help us move forward in really streamlining the process eventually. With that in mind, we feel that this opportunity for the 10-month hiatus will give us the opportunity to do some things that we've been working on collaboratively as the committee and in the department. One, hopefully moving forward here eventually with Community Development Director, I know that we've been working on as an entire board. The other will be looking at the processes that need to be done. And today we took some actions hopefully to move forward with hopefully strengthening that department with some other planning opportunities, planners, and other things as we really move forward in this process of bringing on a new community development director. We're also looking, as we have talked about as a board, to think outside of the box as far as contracting and other opportunities that we'll be supporting the department with, because we just don't have the workforce to do it. And as laid out in the numbers that were put in some of the information that was provided by CAO and also Susan, you know, the interim director is Carol at this point of CDD, you know, gives you the information and the understanding where we're going. It is a challenge as we move forward, but we do believe this is the right direction and the right step to take at this time.
Susan, with the amount of applications that we have in the pipeline and the current staff levels, how long would it take to work through what we've got just now before us?
I think, and again, this is an estimate because every application is different just because of whether it's complete or not, but I would say almost 2 years to get it through completely. And that's because we're not just dealing with the cannabis applications, we're also reviewing non-cannabis applications. So combine that, I would say at a minimum 2 years.
So we've really dug into this, Susan and Carol especially, but Supervisor Simon and I have been meeting regularly. The contractors have been put in place to help take the load off. We've hired planners, we're hiring more, we're trying to build the capacity, we're working on our processes. You know, we are deeply committed to working through this backlog and setting this whole department up for success. And one of the things that we really feel is important, we feel very strongly, is that we continue with this moratorium on early activation so that we can accomplish those goals.
Just some of the conversation, obviously, too, as we're working through that process, with the streamlining process being, you know, for the foreseeable future, the opportunity for us to really get folks into the permanent, you know, use permits. And that's really where we want to push our opportunities to do as we support the new industry coming in, but also other projects that will be coming in. As you know, we have the Economic Development Task Force and other things, but we've talked about this for the past few years. We really need to look at that streamlining process for all projects coming into Lake County as we're trying to develop the economic development opportunities that are here. So it's all going to go hand in hand, but at this time, once again, like I said, we feel like this is the pertinent decision to be made by the board, and that's why we're presenting it today.
Thank you very much for the presentation. Anything further before we open it up for comments and questions?
I just wanted to thank the committee and Carol and Susan for this hard work. I know this is a tough decision to be bringing to the board, and I don't take it lightly, and I know you didn't either bringing this forward, but I think we have to do what's best. When this committee brought this forward because they think this is what is the best for right now to organize and reevaluate this department, and so I definitely agree with this.
Okay. Any comments or questions from board members? Supervisor Crandall.
I just want to highlight that in reading this and going through the memo and asking specific questions, this does not affect anything in the past, and just highlighting that so that people watching and listening will know that it doesn't affect anything like that. It just affects anything being submitted within the next 10 months and 15 days is what I'm understanding, right?
Yes.
Thank you.
Right, so the projects that are already in are still in progress.
Thank you.
So, in reading this, I struggle to put this in with where the industry is currently and where it's going, and it's moving fast. Prices have dropped, which I'm not unhappy about, but it changes things. And our timelines, and I look around the county, our timelines are not horrendous, but they are what they are. And I know some people down in San Diego, took them 3 years to get accomplished. Some people in Mendocino are still not finished, even though Mendocino has a whole lot of things happening. They're still under about 87 to 90% provisionals, meaning they're not really done with everything that they need to get done. I think that the window is getting shorter and shorter, or smaller and smaller, because of the price value drop. And by doing this, and let's be real, we're talking about cannabis, because I don't know how many early activations have occurred for any other business in the past 2 years at this moment in time. So while we say all applications, we're really mostly discussing cannabis here. I think that I would like to make it a smaller time scale personally. I think January 1st, by saying 10 months and 15 days, that means whoever wants to submit an application is going to miss out entirely, possibly by next year. And I think we need to look at something that's going to be doable, viable, and least disturbing to our environment. We could do 5,000 square feet. We could do 10,000 square feet. I think that if we start looking at those small things, that it's an opportunity. And I know that I'm making an assumption, even though my colleagues have their own comments, that we can stop this anytime we want. But if we have stopgaps and milestones, then we can make sure that we're working towards something that is going to work. Early activation has its issues. I think that if we are going to have an early activation in the future that's cannabis related, it needs to be something else other than an early activation, because 6 months on a year state license makes 0 sense for that to overlap and not have the same timelines. So I think there's things that we need to look at to see what's possible, but 10 months and 15 days and saying that it ends on July 25th is basically saying what we have in the pipeline is it and we're done. Because I think that if you can't start by next year, the following year, it's going to be very minimal as to who can and who can't get started. And so I want to make sure that we still continue the conversation of what does a fixed early activation look like, rather than a no early activation at this moment in time. I'm concerned about the 10 months and 15 days. I think it's too long, and it's also, if it is across the board, I don't want to slow down other potential projects, whatever those may be, that could utilize the early activation. I know there's been conversations about early activation being used for previous packing sheds to be brought back to life and using as a processing plant. That would be a really good use of an early activation that can lead to jobs, that can lead to something very substantial here. And if we do a across-the-board halt for potentially 10 months and 15 days, I'm concerned that that helps us miss out economically. I know that there's a lot of capacity issues, and that's what we're dealing with, and that's why this is brought to us. But the capacity issue will go away on its own if we're not open for business as well. So that's my one concern. I don't want to stop this, but I think the timeline's too long. And so I don't know who put their pen up first, but I said something that stimulated thought.
Just wondered, you know, those conversations you have about the timeline was a consideration that we had, as a committee. And at this point, and Anita, you can correct me if I say something wrong here, but this is, under this urgency ordinance and moving forward, the shortest time frame that we have to offer at this point. And ultimately, I just want that, if I'm saying the right thing, clarify that also. Because we did have those conversations too, Bruno, as a committee.
What 65858 of the government code provides is exactly what you said. In that code section, this is the shorter of the two times. In this case, because the urgency ordinance itself was first adopted by your board it was on a public agenda, but not pursuant to a public hearing, which 65858 allows, you are given the option of extending it for 10 months and 15 days. And actually, under sub A of 65858, you can subsequently extend it for a year. Again, 4/5 vote. The longer period of time of 22 months and 15 days is when you've had a public hearing at the beginning and then a public hearing for the extension. And the reason for that is, and the reason for the 45-day time frame is because it is an urgency ordinance, and your board needs to make sure that the public has an opportunity to speak. The other thing, if you'd permit me, that I would like to also say is that this only relates to early activation. Use permits can go forward. And because, frankly, of the level of confusion with regard to early activation, which under both sections that are cited here, the 27.4 and 27.13 of the zoning ordinance, these are a rarity. They are supposed to be a rarity, not commonplace. And somehow they began to morph to be something usual with environmental review of the type that normally you would see for a use permit. What that should mean then is there are a large number of use permits which will give the applicants, and certainly cannabis growers, the opportunity for certainty, because a use permit is always for at least 10 years, and it goes forward with the conditions as opposed to a 6-month early activation. Now, with regard to the 10 months and 15 days, if your board determines, a staff comes back to you and has everything that your board envisions being done, which could be, a couple of meetings, under this urgency ordinance done, you can rescind this. You're not mandated to hold it for the 10 months and 15 days. But this is the length of time the public is informed you may hold it. And again, most of this and the deadlines are to inform the public at large as to what the scenario is going forward. But again, if your board determines that actions can be taken more quickly or more perhaps spot fixes, whatever, anything that happens as staff and community development is looking at this, your board can rescind the ordinance if you feel the task has been accomplished at 6 months or 5 months. This is in the control of your board, but you're right, Supervisor Simon, the statute provides for 2 timeframes, and the lesser of the 2 is the 10 months, 15.
Supervisor Prescott.
So, this question is for Susan, and maybe you can explain the process. So, one of the biggest issues that we were confronted with in the beginning was this mass congestion, because we have applicants with the permit process and the EA application simultaneously being worked through. And the goal with reducing the EAs is to streamline the process to get those applicants for the use permit through the more easily through the process. So can you kind of speak on those kind of 2 simultaneous applications and the struggles that staff was having moving them both through?
Yes, I can briefly, because there are 2 distinct paths. And from the point of application or intake, there's the pre-application meetings, the review for completeness that has to be completed within 30 days. Then subsequently, we submit incomplete letters if needed. Then we wait for their response. So it's a lot of back and forth. So you're talking, we're already talking weeks into this. Preparing the RFRs and the AB 52 notifications, which is our agencies and our tribal units and other different agencies, of course. And then we allow for a time period for them to comment on it. Then there's the site visit. Then we review the agency comments after those 30 days. And then at that point in time, there's a determination, of CEQA. Does it require an initial study? Is it a categorically exempt project? That takes review and time. And at that point, that's happening all at the same time. And then if it does require, because it's even though it's 2 paths, the process of review is the same until a certain point, whether it's a CEQA or a CAT or a category exempted project. But then the next, I would say, 2 to 3 months is the CEQA review, preparing the staff report, the initial study review. There are a lot of steps that it takes, and it can take at a minimum 30 weeks to get to a certain process, and that's if everything falls into place, if all the stars align, which has not been our experience to date, just because it's so new, and the people who are cultivating are new to it too, most of them, not all. Does that help answer your question at all, Jessica?
Yes, thank you.
Okay.
So I know your comment about the window closing and we have a small amount of time. I feel like that's how we got in this situation. It's been only 3 years. We've been absolutely inundated with applications. We've got some really great projects. We've made a lot of progress. But at this point, we have to continue this pause so that we can do our best work. So we can have a high standard, so we can move forward with our department properly reviewing things, so we can have our processes updated. All of these things think of this 10 months as an investment so that we can do our very best work.
And I appreciate the comment, but if we wait 10 months, there may not be that much more work to do. I think that there's a reason and purpose behind a moratorium, and we've already been in it for 45 days. And in fact, I'm going to pause right there. How come we can't extend it for another 45 days? What avenue are we taking that we can't do that again? I know in the past I've seen that where you can extend it. Is it because it's an urgency ordinance? Is it for some reason I feel like I've done that before. I don't think it was here in the county. I think it was in the city of Clear Lake that we extended it, but it wasn't for another 10 months.
Well, under, again, 65858 of the government code, which is the specific section when you're looking at making some adjustments, changes, modifications to the zoning ordinance, which is the one that's applicable. The 45 days is the initial period, and after notice in a public hearing, the legislative body may extend for 10 months and 15 days. It's not to say that you have to, but whatever period of time you extend to is your extension period.
So we can do less.
You can do less, but then you're done.
It's not the lowest number that we can use. We can do 3 months if we wanted to.
You can, if as a board you believe you will accomplish all of the tasks that you're setting out for staff in terms of streamlining this. And when you were talking before about streamlining the use permit process, much of what with regard to the initial study for particular types of properties, there are many jurisdictions that have found ways to streamline this process by looking at the nature of the property and what certain conditions have to be in existence at the time in order to qualify for a negative deck, a mitigated neg deck, or a full-blown EIR. So there are a number of ways that the process can be incrementally sped up as you're looking at the use permits by themselves without the added issues. And if you're talking long delays of 8, 9, 10 months to a year or two on use permits, but you've got an EA that expires in 6 months, you have an issue because now they've begun and still can't move forward. So that also creates a problem. But with regard to this, if your board wanted to set it at a different time period, you may. But a strict reading of 65858 would tell you that's your extension. And then your choice after that is you could extend it for 1 year. And that's what it says. You may extend it for 1 year. So what I would advise you is if the 10 months, 15 days, your board can ask periodically for status updates and reports on this. You have a committee that's dealing with some of this. So you can use that time. If at any point you don't feel that the work is being done that you wanted to have done, which I doubt very much would be the case here, or if you feel that another direction should occur, or if you think the lion's share of what your board envisioned has been accomplished, you can rescind. There's nothing that precludes you from doing that. That's a very simple action. It just comes back on to rescind. The issue with pinning down a lesser time frame is at this point, the report that was done and published is rather perfunctory because it's early days. And until you actually get into the meat of an issue, it's very difficult to be able to gauge time. What you can certainly do is require those reports to occur and be submitted to you on a quarterly basis or, semi-annually or whatever you want, so that you can gauge that process and also then control the time frame. But I'd be careful in terms of giving too short a time frame because you may be this close and not done. But that's just from a legal perspective. Obviously, your board has to do this operationally in the way you think is best.
Thank you. Supervisor Pyska?
So I understand there's changes in the market and there's going to be adjustments, but we're looking for a sustainable industry and we can't rush that. We really have to take our time, work through this immense backlog that we have. If we were to not do this or just do this for a short period of time, we're going to be right back where we were 6 months ago. So just, I said it before, this really is an investment for how we're going to perform going forward.
I don't get how eliminating a potential process for development is an investment. I think that 10 months, I get it, we can stop it, but once it's passed in, taking it out, especially if you're not within the committee itself that wants to take it out or not, is going to be difficult for any other board member to make the change once this is set in stone. I would say I'd like to add that by January 1st, what is our plan? What are we doing? I would like to have that conversation before January 1st. We need to be as prepared as possible to be open for business who may need an early activation outside of cannabis, within cannabis. But what does it mean? I agree it needs to be changed. I think our processes is incorrect. I think they should be seen as the same thing. It's not like you're using two separate properties and planting over on the west side, but your use permit is on the east side when it comes to your early activation. So it's within the same scope of what the entire project is. It's not two completely separate projects. So I've always heard that it's two separate timelines, but I don't understand why it has to be that. And I think that's basically our processes have been done that way, and we need to figure out how to make it the same process. But again, I'm just concerned about the 10 months, and in my opinion, once this is passed, the only people who are going to be able to make it end earlier than 10 months is when the committee feels it's ready to come back out of the 10 months. And so if we can put some milestones, just because I feel I can't change the 10 months, that's the atmosphere I'm feeling. If we can put some milestones that by January 1st, let's have a review. What have we done to solve early activation? What processes have been put in place to help expedite and make it more efficient for early activation? And what does early activation mean as we move forward in the future? Rather than not having milestones set within this, I think we need to set those milestones in there, with hopes that maybe by April or March, we can say, here's what we want to do and what we want to change. I know it's going to take time, it's going to take conversations, but saying 10 months, we're done, when what that does is close a window for the 10% or the 5%, whoever it is, and I agree, if you don't have pre-disturbed land, I don't even see how that can be an early activation. Because there is going to be environmental impact, and early activation is very little to no environmental impact, no grading, no things like that. I think that we created a very vague and gray concept of what that was, and I think it's very simple, in my personal opinion, to create the black and white rules and regulations so that it has the minimal impact, and we can make it be a part of the process rather than a separate process of the use permit. So I'd like to set those milestones, and that milestone should be what progress have we made to establish an early activation program that works, and what progress have we made where the processes of the use permit in conjunction with the early activation have been streamlined to work together rather than be two complete separate processes. And I'd like to hear that by January 1st.
Well, we can meet in January and definitely talk about all of these things. I mean, you're absolutely talking about the processes that we need to work on. We have to do that, and those are the changes that we need to implement. But to be clear, we're still open for business. You can file an application for a permit for any of these projects. But early activation is the temporary permit, or the short-term permit. So we're open for business. That is not what I was saying, but we're not shutting down our economy for any reason. But we have to do this better. And so everything that you mentioned on how we make our processes better and stronger, and we look at our ordinance, that is the goal. But we can come back in January and talk about it. But I think we need to, if we need the 10 months, we may need the 10 months. We may not, but we have brand new staff coming in this month and next month, and there's a lot of learning that's got to happen, and we've got to dig into this work with our processes.
Mr. Chair, if I may, the 65858 discusses the idea that you're entering into a moratorium, essentially, because there's no feasible alternative to avoid the impacts that you're trying to avoid. And there's no less burdensome or restrictive effect. So certainly in conjunction with this ordinance, your board could require reports be issued and presented to your board on whatever period of time you would like to question to see whether progress is being made, whether it's leading to the mitigation, the resolution of these impacts. Because I understand you wouldn't want to get to the end of 10 months and have less than a full picture as to what will be accomplished. And certainly your board could direct staff to provide that in whatever period of time you would want to, which would also give you an opportunity to revisit the effectiveness of the ordinance.
And thank you for that. And I get it that we're open for business, but early activation gives us a competitive edge to get things going. And again, talking about all potential businesses. And I think that we need to minimize this timeline as much as possible. And I will say I have a slight concern with what's occurred just in the last 45 days since the moratorium started, that the response I received was that we did 2 early activations, whatever that is what it is, but that all the rest of the applications submitted are eligible. And in my opinion, that can't possibly be true. Just because you had an application submitted should not mean that we have 147 that are eligible for early activation, because that creates hope where hope should not be. And so that means we haven't gone through and looked at these applications. We don't know which ones are going to really have a larger impact than others and better understanding of what these projects are. And it's already been 45 days. So I'm concerned about seeing that 10 months and 15 days. I know one of our early activations is the Work-Right building that happened, and I think that worked out real well. They have a good amount of staff over there. And so it's not just the cannabis cultivation, it's other businesses as well, and 10 months deletes that competitive edge where we could lose and bleed out some of the potential jobs that we create and things like that. So I would like that milestone to be by the end of the year, not in January, but by the end of the year. What's the strategy? What's the plan? Because I know you guys are working on it, but I don't know what that plan or strategy is when it comes to this. And I'd like to see it by January 1st so that we can really start working on it. Because I'd like to see it done a whole lot sooner than later, and I don't feel like I'm getting the full, and I get it, I'm not on the committee, but I'm not getting the full scope of the conversation to really understand. And please help me understand, because I don't see timelines. I see a moratorium to stop us, but I would be a lot more comfortable if there was a plan that was offered of what the timelines actually looked like.
So let's have that conversation in January, but I firmly believe we need to keep the 10 months in case we need it, but we can regroup in January, and at that point we'll have our staff on board for several months, and we'll have I think it'll be a good time for us to have that conversation.
Yeah, committing to the reporting every, on a quarterly basis is absolutely what we can do. We'll continue working the process. You want to answer something, we did have the 45 days. I know some of the questions were asked, like, hey, how many folks do we have in the pipeline? What is assigned, what is unassigned? So, finding, an opportunity to get it fixed in 45 days just wasn't realistic when we sat down and we talked about it as a committee and looking through that. So we're asking for the 10 months. We'll continue to update the board as we move through that process, continue to have the meetings, but we already know, like I said, even today with some of the action we took on our agenda today, we're adding planners, we are adding staff, we are moving in the right direction, but we're going to need time to work that out. So by the end of December or January, whenever we set up that meeting, starting out the first of the year, we'll have some more of those definitive answers for you. And that's what we'll work on.
Supervisor Crandall?
Yes, Anita, I have a question. Let's say that the ordinance passes because it needs a 4-1, or in essence, 4/5. And so let's say that in January or February, one of the four that decide feel like I don't agree with this ordinance anymore, they can bring it back to the agenda and discuss it again at a given time to rescind.
Your board's creating the ordinance, it's always within your power to rescind it. And as I said, the idea of the reports being done for your board would give you an idea of whether the progress being made is sufficient to justify the point of the moratorium under 65858. Because when you're talking about having a plan and a goal to effectuate change in the zoning ordinance, that's the whole purpose of 65858. It can't exist unless that activity is being pursued and those improvements are going to be the culmination of whatever time period is needed and allowed under the law. So this is a very specific code section to operate under. This isn't a standard emergency kind of provision your board can just perpetually review every 30 days. This is an emergency with the requirement for a plan, and that plan has to come to fruition, either within the timeframes given or before. So your board does these with a goal for particular outcomes. So reports would be perfectly acceptable, and your board could decide at any time, either it's been reached or it's not going to be reached or whatever. You can certainly also, if this doesn't work, at some point you could devise an entirely different urgency ordinance, but when I say different, it couldn't be the same topic. Your board has options with regard to the zoning ordinance. So again, my suggestion of the reports was simply so that your board could gauge the efficacy of this urgency ordinance for you and for the county.
The other thing I'm thinking of is when in the last year we approved an ordinance and we decided to come back in, I want to say 3 or 4 months to readdress the actual ordinance itself. I don't think we did. It was with the masking or the fines for masking, I think it was. I forgot the number of it, but either or, there was something in the passing of that ordinance or that urgency. It wasn't even an urgency, it was a non-urgency. It ended up having to be, but we ended up having to, we decided that we would come back at a specific time to ensure that we would either move forward or, so I don't know if that applies here.
If your board wishes to have it come back at a specific time again to gauge progress, status, etc., that's completely within your purview.
Thank you.
I do want to ask a quick question on that again. If, just to finish up the hypothetical, if it was to be brought back to the board for rescinding, it would still require 4/5?
Majority, I believe.
When you're rescinding an urgency ordinance?
I believe. I'll double check that for you, but I believe it's just a majority.
Yeah, I wasn't quite sure if it goes in one way and comes out the exact same, or if there's a difference in how the voting matters.
And sadly, while I prepared for all facets of 65858, I did not prepare for it now.
I'm happy I could find one question. Anything further from the board? All right, let's go ahead and open it up to the public. Raise your hand if you're in the Zoom room, or come up to the microphone if you're in the boardroom. Let's go ahead and start in the boardroom. We will get to you in the Zoom room. Please state your name, and you have 3 minutes.
Hello, Chris Jennings, cannabis operator in Lake County. You know, it's pretty clear that the early activation moratorium is a direct attack at cannabis. It didn't even come about until everyone was freaking out about water usage and everything else. So I'm happy that you guys are keeping it fair across the board, but I think everyone here needs to really step back and look at the bigger picture. You know, Carol made a comment about early activation's up in 6 months, and then you're, you know, what now, because then your permit takes 10 months. Well, you can actually extend your early activation a second time, and you can even get a third time with approval from a community development director. I've been early activated 3 times because the county staff upstairs kept coming up with new things that wasn't even in building code context to throw at me. So I've been through the gamut, I guess you could say, the ringer. The bigger picture isn't all the cannabis projects coming in line. The bigger picture is our staff upstairs, because I hear you, Moak, we have all these people coming in, we're gonna get them trained, we're gonna turn this around. But no offense, I've been here coming to these meetings for the past 10 years, and I believe Tina Scott's the only one that's been here longer than everyone else. It's the same thing. We don't have staff. We never have staff. We never have enough staff to do anything, because our staff comes and they leave. They want to come, then they want to become a cannabis consultant, and they don't even know what they're doing, and they screw up everyone's reports. Or they come here, and they come to Lake County, they get the training, and they go back home down south. So, like, you know the old saying, it takes money to make money. It'd be really nice to know how much money the county has spent reinvesting in the cannabis business of running the cannabis business. You know, like, if we got to pay people more to get people in and get them going, that's what we need to do. The lady on the screen that's talking about how, like, oh, it's 2 separate reports or an early activation doing a non-early activation. They parallel together. You need CEQA in order to get early activated. And then you move on to your initial study and you wait for a use permit. The whole point of an early activation is waiting for planning department or the planning commission to approve us. If anything, we should have a law like some of these other counties have, where you have 1 year to get through a use permit. If not, it's approved. Like, that would really put some fire into some people and get projects moving like they should. But that's the whole point of early activation. Things take so long, and we take forever getting the planning, so we're allowed to early activate. We all have to meet the CEQA guidelines. We all have to do the bio review, the archaeological review. We have to have all these things. I think it's like Appendix G or C when it comes down to it. There's plenty of people I'm sure might speak up in the Zoom room that know these things a little bit better than I do, but the problem isn't early activation and the projects. The problem is we have so much black market out there. There's not any enforcement going on. The problem is when an Excel sheet forgets to get updated, and then we have 12 armed sheriff personnel on a friend's farm about to chop them, and every plant has a metric tag on it, and it took the cops 2 days trying to get a hold of someone upstairs to say, oh, it was a clerical error. Like, that's our problems. That's the core problem from an outside person and an inside person at the same time. Those are our problems. It's not early activation.
And
it's what we have.
3 minutes are up.
Sorry.
Final comment. Thank you. And is there anyone else in the boardroom? Go ahead and come to the microphone, and then we'll move on over to the Zoom room.
John Moss. I was talking to a young man who works in the industry and the water companies, and I want to contribute that it's a big problem. If you hold off with activation, you have people moving out because they cannot flush their toilets, and yet the early activation commercial marijuana lets them have as much water as they want, and the vineyards have as much water without any regulation. So I'm pointing out that we're at a crisis stage with water. And these marijuana growers are at a crisis stage with waiting and waiting and waiting. And we just might all have to wait too long until the county is completely empty. I just have a lot of sympathy for this guy who keeps trying and trying to do things the way the state tells him. And then the black market marijuana comes forward. It's not an easy subject. I know, it's a big problem. And the big problem sometimes is Mother Nature and the drought. Thank you.
Thank you. We'll move on over to the Zoom room. First is Darylyn. If you can please provide your first and last name, and you have 3 minutes.
I did not raise my hand.
Oh, well, your hand is raised, so we'll go ahead and...
Sorry.
No worries. Let's go ahead with call-in user 1. If you can please provide your name, and again, 3 minutes.
Good afternoon. Can you hear me?
Yes, we can hear you.
All right, wonderful. My name is Angela Ann, and I just wanted to bring up a couple of things that when this urgency ordinance first went before the board, when you guys were discussing it during the original implementation, you guys had addressed the issue of it being exploited and used as a loophole before an application is completed. The difference between the workforce project and the early activation for cannabis is that the workforce project didn't cause large amounts of environmental disturbance before the studies were completed. So I just wanted to remind you guys of that and be aware that early activation, there is a lot of damage done that can be rectified later on. And thank you.
Thank you. Next is Jennifer Smith. Again, please provide your name and 3 minutes.
Hi, this is Jennifer Smith. I'm concerned that we are once again changing the rules, changing the process for these people that have been in the queue, these applicants that have been in line for quite some time. So while I understand the need for a moratorium in terms of a staffing issue, the staffing issues will always be there. I would feel more comfortable if this perhaps affected new applicants.
So if I may interrupt real quick, this is for new applicants. It's new applications for early activations that there would be a moratorium. As stated earlier, I believe, and Ms. Parker, please correct me if I'm wrong, there's 147 eligible applicants right now to ask for early activation still.
Yes,
okay.
145.
145.
My apologies, I wrote this earlier. Anyways, I just think that we need to, where's the path forward? Do we have some timelines? 10 months is a really long time. I've been through a few urgency ordinances before. If this can be reviewed in December and overturned with a clear path, I think that the industry would feel a lot more comfortable. I think the priority is to get the staffing and the process, and also work on those simultaneously and not one and then the other. Thank you.
Thank you for your comment. Sean Connell, please provide your name, and you have 3 minutes.
Good morning, board. Can you hear me?
Yes, we can.
Perfect. I'm Sean Connell, District 4. I've talked to you multiple times when it comes to cannabis and early activation. Actually, I still have memorandums and emails that I sent to you in March when we started talking about changing early activation process for cannabis applicants in the county. I do want to say that at this point, this is becoming discriminatory as every change, while we want to lop it into land use, it is really directed at the cannabis industry at this point in time. It has been multiple months, I believe since January, that I started talking to this board about if you really want to set yourself up for success, you need to heavily invest into this industry. And by doing so, would be the first step is to establish a department, with subject matter experts who could provide you pertinent, timely, accurate information on the industry in front of you, in our area, in our region, and across the United States. I've heard multiple people talk about water use. Water use is based on an old paradigm when you were limited to 25 plants, which means that if you were going to be an economical business, you needed a massive plant in order to gain the benefit. At this point in time, we are talking about acres upon acres of canopy area, which for most businesses means a much smaller, much more manageable plant life spread across the land. As we sit here and we talk about early activation being a two-pronged process that's absolutely inaccurate, and anyone who continues to feed that to the public is wrong and should be held accountable. It is the same process. It's a $190 additional fee on the application process. As Ms. Parker has already laid out, it is the county's responsibility to accurately review that paperwork within 30 days of application and provide you either an incomplete or a complete notice. Then it gets referred to the community agencies. That's an additional 30 days where every department in your county has the opportunity to condition the application in accordance with their ordinance and regulations. Article 27 is very clear when it comes to early activation. It's up to the community development director. Granted, in Lake County, we haven't really had a community development director in quite a few years, and all of the assistants have seemed to magically left for better and greener pastures. I cannot see how anyone can tell you that investing into a burning down, failing business is a smart investment. I think what needs to happen in this county is we need to buck up to the table. We need to recognize that this county attracted quite a lot of applicants for cannabis cultivation. We are an agricultural-based county. I get mailers from this county that remind me that I live in an agricultural community where dust, odor, smell, and heavy equipment operation are a part of the conditions of living here. I think that your job at this point in time is to not enact a new ordinance, to not put in a moratorium, but instead to use your investment to establish a department where they report to you, where they can tell you how many applications, for what size of canopy, in what zoning district, in what district they belong to. So that way that we're not standing here talking about all of the crazy.
And your 3 minutes are up, if you could finish with the last statement.
Yeah, my last statement would be, I think that 3 minutes is far too short to give you the nuances of this industry, and that it is time for you to establish and create a department. And with that, I will let you go. I appreciate your time, your efforts, and I will be here next week to talk to you again. Have a great day.
Thank you for your comment. Jonathan Braniff, again, please provide your name, and you have 3 minutes.
Good afternoon. Can you hear me okay?
Yes, we can.
Hi, my name is Jonathan Braniff, and I want to congratulate you all on all of your efforts in navigating some of these interesting and challenging spaces. I wanted to share with the Board of Supervisors in the County of Lake, much like with Train Technologies applying for the PGE grant, as well as the work that you're talking about here and various other activities that are happening on a county-wide basis, we wanted to basically invite the Board of Supervisors to consider approving a resolution allowing the county, hold on there. What I'll do is I'll hold off on this for a moment until we can revisit this on the PG&E item. I think I'm on the wrong item.
Okay, I was getting a little confused, but I didn't want to tell you I was confused, but yes, we will be to the PG&E item soon. Thank you very much. Next is Bobby Dutcher. Again, please provide your name, and you will have 3 minutes.
Well, Bobby Dutcher, it does seem really unfair to, actually encourage people to apply for something, and then after they waited maybe a year and a half, then create a moratorium that stops them from getting the permit that they've applied for. And since early
again, I'm going to interrupt because, again, just want to make sure it's clear to the public. I'm pretty sure it's clear to the board that this is for new applications requesting early activation, not for applications already submitted. Again, we said 145 applications are eligible for the early activation.
On the agenda, it says the issuance of early activation.
Well, they're eligible for getting an early activation if they pass every other criteria and threshold that needs to be passed. There's a process.
So the people who have applied for early activation will still be able to go forward, and we might be able to approve them like next week. So this is just on applications rather than issuance.
And I don't know about the next week, but I'm going to move this to Ms. Parker to see if that is correct, that they are eligible for issuance if they are part of the 145.
Yeah, those applications that are in the pipeline are eligible for review to determine eligibility if they haven't already been done so, if that hasn't already been done. And then for our unassigned, of course, those will be reviewed too. So because it's assigned, they have many projects that they're reviewing. They probably have not completed one, and I don't know Mr. Dutcher's project, but he could, I'd be more than happy to look it up if he wants to contact me offline, of course.
I don't have a project going, but yeah, if, the way this reads on the issuance, if you're not going to issue anymore, that seems really unfair. People have already applied and are really close to getting their early activation. So,
it does not apply to applications in the pipeline.
okay, because it seems like since your early activation permit's running in parallel with your use permit, I find it hard to believe it creates that much more work for staff. And when you look at it, it's pretty easy to keep track of staff scorecard on permits that are being completed. One of your planners has brought 30 of his projects to a planning commission hearing. The other 4 combined only amount to 20. So it really seems like, we just, if you could get the other planners up to the speed of the one planner you have, that would get rid of a lot of the backlog. So it really seems like the backlog is due to staffing rather than the process of issuing early activation permits. So I agree with Supervisor Sabatier. I would rather see this have a much shorter timeline. You could always come back in like December 31st or January 1st or in 3 or 4 months and take another look at it. And if you needed to extend it, you could. But if by turning it off, that sends a really bad signal to the industry that you're not going to look at them again. They're not going to have a lot of confidence.
3 minutes are up.
So I like to see a shorter time. Thank you.
Thank you. Next is Aaron. If you can please provide your full name, and you have 3 minutes.
Hello, this is Erin McCarrick in Clear Lake. Hope you guys can hear me.
Yes, we can.
Awesome. Thank you for clarifying Jen and Bobby's question. I had a similar question about if it was new early activations or ones that had previously been applied for. So thank you for clarifying that. Thank you to the committee and to the CDD for considering those 147 applications. My request would be to just really encourage communication with those 147 people, the applicants, cannabis or not. I know some folks in the Chamber of Commerce who have applications in who also feel confused. There was 3 of us on the call who were a little vague about who qualifies for this. So with good best of luck to the new CDD director and all the new staff, and just really hoping that the committee or the CDD is able to communicate to these stakeholders what they need to do and where they are in the process. Thank you for your time. Thank you, Chair and Board.
Thank you. And we have another hand up, and it's a repeat, just checking in the boardroom. Is there any comments in the boardroom? All right, let's go ahead and go with Jennifer Smith, and then we'll go ahead and close public comment.
This is Jennifer Smith again. I apologize. Definitely was unsure of the direction before, and I'm going to state a probably very unpopular opinion in my cannabis community. But until we have a streamlined process, I don't support new early activations of any project in the county, not just cannabis, but any project that may require or has the ability to have an early activation. The department needs to get staffed up. We need qualified staff that are subject matter experts. We need a department. We need a process that isn't, I don't know if the process is cumbersome or we just don't have the staffing, but it does need to be fixed. I'm not happy about 10 months. I think that we are better than this as a county and that we can figure this out sooner. But as has been pointed out in the past, early activation was a bridge from the old program to the new program. We can't continue to use it as a crutch. People did come to the county with the assumption that they could get early activations because that was the status and that was how the program was working. If we're going to make changes, the time is now, but let's get it fixed by January would be my preference. Thank you.
Thank you. And with that, we're going to close public comment and bring it back to the board for any further discussion or questions or comments or action.
Well, I think the last comment illustrates what Supervisor Simon and I have been working on and what our goals are, and I'm more than happy to set a time in January to come back and we can talk about where we're at then and what our strategy is, and then we can make decisions on the timeline then. But as we are right now, with the new staff coming on and all the investments that we're making in the department, I feel really strongly that we need to stick to the 10 months.
And I want to respond to that, and I got to choose my words correctly. Last week, we didn't approve of a contract. I mean, eventually we did because it came to us differently, because there was no agreement in front of us to say why we should approve that. Here, we're approving a moratorium for a longer time, and there's no plan proposed here. If it's possible, please bring us a plan before January so that we can see what is occurring to get this fixed. Right now, it's saying, go for it, fix it, and I don't know what that means. Because it's just asking for 10 months. I don't know what the strategy or what the timelines look like. And I think that if we do continue on any other type of moratorium, it is going to need that level of specificity as to why is it a moratorium and what is the plan to get out of the moratorium and into a better place. Right now, it's rhetoric. It's not anything specific that's shown to the public and to the board as to this is what we're going to do today because this is what we're working on to fix for tomorrow. And I'd love to think that there is a plan, but I don't see it. Therefore, I'm asking, can you please bring that plan sooner than later and then bring us an update in January?
Yes. And I think, you know, one of the reasons we don't have that plan for you is because we are waiting for staff. And we really need to have the input of some of these positions filled, and that's really the next step.
Okay. Supervisor Simon?
No, I just want to follow up with Jessica here. You know, we know that we have to work on this as we're doing as the committee. There are steps and processes that need to be done. The community development director is a big piece of that. And we are all working on that together. So to say that we don't know what the plan is to get a community development director, to get this thing moving forward, and to really move the department to where it needs to be and be ready for next year's growing season in a more proactive way. And that's, if you don't know that, I'm sorry, but we know it's on our agenda today of what we're doing. So those steps and processes are happening. I understand what you want by the end of January is what you're asking for. And by that time, we should be able to have some more definitive project timelines as we're moving forward with the updates. And we'll continue to work on that as a committee. I know that CAO Hutchinson and also Susan Parker will be involved with that, and all the folks that need to be involved in those conversations. So we hear you loud and clear, but today we're bringing this ordinance because we believe this is the path forward that we need to take. So, and I'm in agreement with the 10 months at this point, but willing to review that and to work hard between now and January's update as the committee.
Supervisor Crandall?
Yes, I have another question, Anita. I'm sorry.
Don't be sorry.
Anita, if let's say that hypothetically we said let's try 5 months with the urgency ordinance, and then when we if we bring something back like a non-urgency ordinance, could it be the same subject, or does it have to be a totally different?
If you mean you're coming back with an ordinance that's fixing this, or just unrelated to this completely?
Kind of the same. Like, so for example, right now we're talking about 10 months, but I'm saying like February 1st is 5 months away. And so Supervisor Sabatier is asking for reports that specifies what we can and cannot do. So let's say we do the urgency ordinance that eliminates early activation for now till February. And then at that time, we do realize we still need more time. What road can we take from that point forward if we need to move forward, or is it not exist because we already?
Well, the extension period, and again, the statute sets out these periods of time. They're permissive periods of time. and it can be extended one more period of time for 1 year. But I think that you're going to find, and I can tell you just in terms of revamping this ordinance and streamlining this so that the use permit process is more effective, so that minor use permits actually can fulfill a vital role here for a lot of these cultivation sites, because of the nature of the sites and what's been done on them before. To do all of that is going to take a little bit of time, particularly if your board wants the community, you know, through workshops or whatever, to be involved. Nothing would, these changes would improve the system, which has just, I think, been kind of confused and bogged down. And frankly, the zoning ordinance over the years has become a patchwork quilt. So this streamlining process is very important. The issue is always that you get into it and find that there may be more. So what you could do with this urgency ordinance, however, is if you come up with an ordinance that's going to resolve a portion of it, then your board could look at the urgency ordinance and see whether in its present form it needs to remain at all. So in other words, if you had another ordinance in February that was going to address a lion's share of this, given the standards of 65858, you may find the conditions don't still exist. Not those conditions. There may be additional, different conditions. The 10 months is a benchmark because of the nature of zoning ordinances. The legislature is looking at what normally occurs when you're taking a zoning ordinance and revamping it because of its scope. And again, these are maximum times, but I don't see that the law allows you to say, well, we'll do 3 months and see how it goes. Yeah. Okay. But again, you could come up with corrective measures that would obviate the need to continue with that ordinance as written, or that would shorten the time for you. So you actually have a lot of flexibility. The 10 months, 15 days in this case for this extension is what you can do. And if you need the time to develop the full panoply of ordinance changes, or if your board decides, well, you know what, if we fix this, we're going to be X% ahead, and that's a big deal, and we'll work on the other things. Until you get really into it, you don't know if there are multiple fixes necessary or just one. And unfortunately, I'm being vague because there's no way to answer that with specificity.
No, there's not, because you said that there's the code or the law kind of specifies the 10 months anyhow.
Well, again, you can do less if your board chooses to, but if you have the 10 months, I think from a legal perspective, you'd be much better taking the 10 months, 15 days and repealing it, rescinding it, if you don't need it to be that long. You know, or any part of the ordinance, you don't need to be that long. And certainly things can happen much faster, but streamlining the use permit process isn't, if that's all that needs to be done, you could probably do that within 4 months maybe less. But it depends upon how you want to revamp with the early activations in that process. So I do think that getting a report as to the planned approach, so that to make sure that before too much work is done, your board is comfortable with. In other words, you wouldn't want a whole thing presented and then have you say, well, this isn't what we wanted. So, you know, it's possible to sketch out a skeleton framework of the streamlined process for this. That's not difficult to do. And my office is ready and willing to help anytime you want us to.
You good, Supervisor Crandall?
Yes, thank you, sorry.
Thank you very much for the response. And believing that there is no more deliberation, looking for action.
Mr. Chair, I'd like to offer the ordinance.
The ordinance has been offered. Johanna, roll call, please.
Okay, Supervisor Simon,
Yes.
Supervisor Crandall,
Aye.
Supervisor Scott,
Aye.
Supervisor Pyska,
Yes.
and Supervisor Sabatier.
Nay.
Thank you.
Thank you. It is 12:30 PM. Let's go ahead and, do you guys mind if we keep going till 1 PM and then take a lunch? Okay, so let's go ahead and staff, is staff okay with that? Okay.
Johanna's the only one I'm going to check in with. Johanna, are you okay till 1?
Yes, I'm good.
Well, we're used to it. She has something else to take care of.
So 6.6, 11:30 a.m., consideration of agreement for operational analysis of indigent defense services, and going back to CAO Hutchinson.
Thank you, Mr. Chair. Susan's going to give more detail on this, but I will say that what is before you today is the culmination of work that Susan and I have done over the last couple of years as we think about the future of the public defender program here in Lake County. I think you're all aware that the county is required to provide public defender services for persons that are not able to provide that service for themselves. And so knowing that it was time to take a look at the operation of this program and make best decisions, we recently issued a request for proposals that got us to this point today. And so we have 2 of 6 AC representatives here with us in the Zoom meeting. And Susan, I'll turn it over to you. Thank you.
Thank you, Carol. Good afternoon, Board. Administration brings this item forward for your consideration because we manage the Indigent Defense Services contract. In the state of California, counties have been delegated the responsibility to provide and protect the Sixth Amendment, which ensures that no person accused of a crime goes to jail without first having the aid of a lawyer with the time, ability, and resources to present an effective defense as required under the United States Constitution. In order to determine our structure and processes best meet the national standards and the Sixth Amendment case law, and of course, state, local, and federal laws, we developed the RFQ seeking a subject matter expert who can provide an independent and objective evaluation focusing on 3 primary areas. The first area is the best practices to ensure the protection of the Sixth Amendment right. The second area is determine the appropriate compensation methodology for indigent defense